open with a moment of silence, really in remembrance of the lives lost in East Tennessee to the floods, my home, and as well as the Tennesseans out there and the Tennessee families that are still suffering as a result of the current opioid crisis that we're in. We're going to do that. We're just going to have people introduce themselves in the room.
Yeah, that's fine. 1 second. Elizabeth, are we recording? Okay.
All right, I'll go ahead and we'll just, we would introduce ourselves going around the table here. I'll start to my left with Sean.
I'm Sean Smith. Excuse me. Sean Smith. Excuse me. My old job. I'm Sean Smith, Deputy Director, LAC. Thank you.
Marie Williams, glad to be here. Glad to get so much. Commissioner for the department.
Elizabeth Friedman, Program Director, OSD Office.
Me?
What's that? You're. We haven't got around to you yet, Lisa. That's all right. That's all right. Thanks, Elizabeth.
They can, yeah. Kurt Hipple, Assistant Commissioner for Planning, Policy, and Legislation with the Department of Mental Health and Substance Abuse Services.
Wayne White, member of the board. Tim Fortnite, cardiologist out of Fruitville, Tennessee.
I'm Brian Buck. I'm the CEO of Ridgeview.
Clay Jackson, Powell physician, Memphis.
Casey Cost, Sheriff of Cumberland County.
Armando Fontes, retired sheriff of Cobb County, current law enforcement liaison for the Eastern District of Tennessee.
I'm Lisa Gibson Steele, and I'm the Executive Director of Families Free.
I'm JP Urban with the Tennessee Attorney General's office.
Before you go, can you jump back to the back row here?
Yes.
Sure, these are on.
Yeah.
Hello, Wes Gemmon, chief pharmacist for the department.
Speaker say, I'm the executive assistant to Mary and team.
Marie McGrath, senior policy analyst.
Mark career grants analyst.
Ella Redden, project administrator.
Melissa Gilbert, accountant and fiscal monitor.
All right, Mary Shelton, Executive Director. And then if we could get the council members who are attending virtually.
Mike
Karen.
Flynn. I'm sorry.
Okay, Mike Flynn. That's okay. Go ahead, Mike.
Mike Flynn, council member, retired district attorney from Blount County.
All right, Karen.
Karen Pershing, Metro Drug Coalition, Knoxville.
Stephanie.
Stephanie Vanderpool, pain management physician, UT Medical Center, Knoxville.
Tommy.
Tommy Farmer, TBI.
Shane.
Shane Sexton, retired criminal court judge, council member.
Did I miss any council members? Right, and then do we have a quorum?
We do have a quorum.
Okay, great. And we have a couple of others. So we did Commissioner. Yeah, introduce myself. Sam, will you introduce yourself, please?
Good morning, Sam Buckley, attorney for the Department of Mental Health and Substance Abuse Services and legal counsel to the Opioid Abatement Council.
All right, it's good to have you back, Sam. I'm Stephen Lloyd. I'm an internal medicine, addiction medicine physician here in Middle Tennessee, and I'm the chair of the Opioid Abatement Council. Thanks, everybody. Thanks for your time. It's good to see everyone. It's been a little while. Our September meeting was canceled secondary to the floods. I was up over Thanksgiving, and my dad lives right on the Nolichucky River, and it's a pretty unbelievable thing to see. As bad as the pictures look on TV, I promise you they're worse. And I grew up on that river, so it's a weird thing to see it flowing in different directions now at times, which is a kind of a strange thing. There's still over 100 people missing up there, mainly from Western North Carolina. Hasn't got much news coverage, and just families just devastated in the field that we work in here with substance use. You can imagine what something like that would do to somebody's life who was struggling to get into recovery. And so we efforts up there, in my private practices, and really the community response is impressive. And I always love seeing the community response in Tennessee and in Northeast Tennessee. I can promise you that the community is alive and well, and they will recover, but it's going to be a long road. So it's good to see everybody. Tommy, I'll remind you to keep your eyes on the road. I see you driving and looking at that, so I'd hate to have to pull you over. I want to go ahead and get started with, a review and approval of our minutes from June 18th, July 31st, September 6th, and October 28th. We probably need to address these one by one. Oh, before we get started, there's something that JP reminded us of that we need to do.
That's one word.
That's all words.
Yeah.
Okay, all right, just want to make sure, JP. All right, we'll start with the meetings from June 18th, 2024.
Move to accept Vanderpool.
Dr. Vanderpool said motion to accept.
I'm sorry, Dr. Vanderpool, I didn't hear you very well. Dr. Vanderpool has a motion to approve the June 18th minutes. Do I have a second?
Second, Shane Sexton.
All right, got a second from Judge Sexton. Mary, we just want to do roll call votes. I think that's where we need to be. All right, unless there's any discussion, we'll proceed with roll call vote.
Armando Fontes,
Yes.
Brian Bott,
Yes.
Casey Cox,
Yes.
Sean Allen's absent, Clay Jackson,
Yes.
Karen Hershey, Jim Moore's
Yes.
absent, Lisa. Oh, sorry. Sorry, Karen. Lisa Tipton,
Yes.
Mike Flynn,
Yes.
Shane Sexton,
Yes.
Stephanie Vanderpool,
Yes.
Steve Lloyd,
Yes.
Tim Fournette,
Yes.
Tony Farmer,
Yes.
Wayne Whitehouse.
Yes. All right. And now the meeting is from July 31st.
Move to accept Vanderpool.
All right, so I have a motion to approve by Dr. Vanderpool. Do I have a second?
Second.
Second for Mr. Wyckoff. Any discussion? Hearing none, we can proceed with roll call vote, Mary.
Armando Fontes,
Yes.
Brian Bott,
Yes.
Casey Cox,
Yes.
Clay Jackson,
Yes.
Karen Hershey,
Yes.
Lisa Tipton,
Yes.
Mike Flynn,
Yes.
Shane Sexton,
Yes.
Stephanie Vanderpool,
Yes.
Steve Lloyd,
Yes.
Tim Fournette,
Yes.
Tommy Farmer,
Yes.
Wayne Whitehouse.
Yes. All right, so the motion carries. The minutes from September 6th, 2024.
Motion to accept.
A motion to accept by Mr. Wyckoff. Do I have a second?
Second.
Second by Brian Buck. Any discussion? Hearing none, Mary, if we could proceed with the roll call vote.
Armando Fontes,
Yes.
Brian Bott,
Yes.
Casey Cox,
Yes.
Clay Jackson,
Yes.
Karen Hershey,
Yes.
Lisa Tipton,
Yes.
Mike Flynn,
Yes.
Shane Sexton,
Yes.
Stephanie Vanderpool,
Yes.
Steve Lloyd,
Yes.
Tim Fournette,
Yes.
Tommy Farmer,
Yes.
Wayne Whitehouse.
Yes.
All right, so the motion carries. And last but not least, the minutes from October 28th, 2024.
Motion to approve.
Motion approved by Sheriff Cox. Do I have a second?
Second.
Second, I'm sorry, by Dr. Fournette. Any discussion? Hearing none, Mary, if we could proceed with the roll call vote.
Armando Fontes,
Mr. Chairman,
I'm sorry, let's say, Dr. Jackson.
I apologize. I did have a question about the minutes from the meeting regarding the funding of the SMART initiative, which is the last action item that was undertaken.
Right.
There is a final motion for approval, and I had a question as to what the vote entailed and whether that was correct, represented in the minutes.
Did we vote to approve 2 years of funding or to authorize the executive director to engage in contracting and negotiations and or execute contracts? It was my understanding that we had agreed to a contract with Smart. However, these minutes indicate that it allows Mary to engage in negotiations and or sign.
Let me give you the question one more time. What's the?
Did we vote that they had a 2-year contract or did we vote that you could negotiate?
Probably need to go back and look. I thought it was both, like engage in negotiations and contract.
It does not say both and, it says and or.
It says and or, okay.
Believe it or not, actually,
Sam, did we ask Sam to look at that right now? I mean,
Sam, the commissioner asking, I think it's a good question. Can you look at that? You have the ability to look at that right now and tell us what we did. I remember the discussion very well. I just can't remember what our final outcome was on it.
I'm happy to look at it. Is there any way I can get access to the minutes?
Could you send in the minutes?
Yeah. Elizabeth, do you have the transcript in front of you?
I'm gonna pull it up. That's what I'm gonna.
Yeah, because Sam doesn't have the recording to go back to, he doesn't have this document.
So, Mr. Chairman, in the interest of time, would it be appropriate to table this motion for now and pick it off the table later in the meeting and proceed with ordinary business while Sam reviews the minutes and gives an opinion as to what we voted on?
Can I take that as motion?
I move that we table the approval of these minutes until later in the meeting, such time as the chair and the commission would deem appropriate.
You got a motion on the floor. Do I have a second? Second. Our second to Dr. Fournette. Any discussion? All right, Mary, if you'll proceed with a roll call vote.
Armando Fontes,
Yes.
Ron Buck,
Yes.
Casey Cox,
Yes.
Clay Jackson,
Yes.
Karen Pershing,
Yes.
Lisa Tipton,
Yes.
Mike Flynn,
Yes.
James Sexton,
Yes.
Stephanie Vanderpool,
Yes.
Steve Lloyd,
Yes.
Tim Burnett,
Yes.
Tommy Farmer,
Yes.
Wayne Wyckoff.
Yes.
All right, the motion carries. And Sam, if you'll let us know whenever you have reviewed that to the point of giving us an answer, if you'll interrupt, we will revisit this issue out of order, if that's okay. All right, moving on, Mary. Got it. So we will start the meeting the way that I'd love to start it, from the time we all started meeting back several years ago, and with our why. And our why today is a tad bit different. Had this on the agenda for September, but pushed it to today. I guess when I look back at my time in working in the department and seeing how Tennessee has changed over the past 5 to 10 years, really even 15 years, with regards to how we handle substance use in our criminal justice system. The two people, in my opinion, that had the biggest effect on that, my former colleague, Ellen Abbott, and Judge Dwayne Sloan. I think probably the folks that work for the department would more than likely agree with that. And unfortunately, we lost Ellen several years ago in a car accident. She was hit while crossing the street. And in August of this year, we lost our friend, Judge Dwayne Sloan, as he was struck by a motor vehicle as well. And so I put a few pictures up there. Probably the most enjoyable time of my professional life is represented on the left. Me, Judge, and Tommy running the state of Tennessee, doing what we did, trying to educate courts around the state on handling people with substance use disorder. And it was a really great time of my life. I think Tommy enjoyed it as well. We learned Tommy can play the piano, actually. And then on the right is Judge and I in Washington, D.C. Judge Sloan was a recipient of the William H. Rehnquist Award, which is the highest Supreme Court award given to a state judge. And so we had an entire night in the Supreme Court in the United States back in, I think it was 2019. It was before the pandemic. And it was hosted by Chief Justice Roberts. Justice Clarence Thomas was the other judge that was present that night. And I think Commissioner was there. We had a really good time. They asked us to leave whenever we sang Rocky Top in front of the Supreme Court, but they did let us finish, and we finished on a high note, just so you know. But it was probably the happiest that I've ever seen Judge. He wasn't just a colleague for me. He was a really close friend, and I miss him. I still can't believe that. I can't pick up the phone and call him, because I did it so many times. And I know Karen Pershing is on our council as well. And Karen had the same experience with Judge. And, I used to call Judge a unicorn, and we'll have somebody that takes his place, but we won't have somebody that replaces him. His heart for helping people that had substance use disorder was unmatched by anybody that I've ever met. He adopted his son Thomas out of his drug court. Thomas was born drug dependent and spent the first 52 days of his life in Children's Hospital in Knoxville with neonatal abstinence syndrome. And you don't meet people like that too often. So I want to make sure that we recognize Judge, and I also want to make sure that we don't forget the contributions of Ellen Abbott. And Ellen was a dear friend, but she also did so much to change, how we address these folks, in our court system in Tennessee. So big losses for Tennessee, both Ellen and Judge Sloan. Shane Sexton was a close friend of Judge's as well. Matter of fact, just a couple of years ago, Shane and I were in Judge's wedding, which is a weird thing for a 55-year-old guy to be in a wedding, but we were, and we enjoyed that time. And it's really hard to believe that we don't have it. So, Judge, if you're watching this, we miss you. All right, next up, Mary, our office staff updates, and there's one I'm glad they're all here, but there's one in particular I'm really glad to have on board. So if you want to go ahead.
Curious. Yes, so everybody went around and introduced themselves. We have David on virtually. David, would you like to say hi?
Hi, David Sappington, Grant Analyst for the Opioid Abatement Council.
So I just wanted to share, thank you, David. I just wanted to share with the council all the staff that we have right now. We do have one vacant position, and we're getting ready to hire our second accountant and hopefully have that position filled after the first of the year. So very thankful all the staff are here, and thank you guys for approving them. I feel like we've got a very well functioning office, so thank you. Anything else you wanted to say on that? Oh, sorry.
I think you're going to finish that quick.
Oh. I told all the speakers to be brief, so I need to model being brief.
Absolutely. So if you're curious about which, I'm glad they're all here actually, but I'm really glad that we have Marie, because Mary and I had to sit down in front of our legislature not long ago, undergoing our state audit. And about the only thing we fell short on was policy. And now we are in the process of correcting that. So Mary and I are really glad to see you. Actually, they were quite kind to us.
Yes,
but
they
it sounded way worse than it was.
They were.
All right. Member appointments, Mary.
Okay, yes. And so I'm going to turn it over to JP Urban for just a minute to share some information around the law and appointments.
Hi, everybody. Mary asked me to just briefly summarize the way the statutes work here for the Opioid Abatement Council. The General Assembly created the council there in 33-11-103 to be 15 members. You can see the qualifications are set out by statute. And the way to get onto the Opioid Abatement Council is to be appointed by one of the individuals or entities listed there. So the governor, Speaker of the House, Speaker of the Senate, Tennessee County Services Association, and Tennessee Municipal League. So that's how these members ended up on this council.
This is the terms.
Okay. The council members serve initial 4-year terms, except for certain members, and then they are each appointed member serves a 3-year term after the initial terms, and that's to establish staggering of the council. It's all set forth in the statute how that all plays out, but it ends up with a functioning board where appointments keep rolling. And if a member is not, if someone is, there's not a new appointment made, the appointed member will continue serving until a new appointment is made. We talked about in the previous meeting.
All right, thank you, JP. And with that, I do have some good news. We did receive appointments for the 4 members whose terms ended in June 30th. And so Governor Lee has reappointed these 4 members. That's Dr. Stephen Lloyd, Armando Fontes, Mike Flynn, and Dr. Clay Jackson. So thank you guys again for agreeing to serve an additional 3 years, and looking forward to working with you guys.
Thanks, Mary. And JP, I want to thank the AG's office, General Committee, Lacey, yourself. You guys have been great. I've called and pestered you with stuff, and I certainly appreciate everything that you've taught me going forward. And I've kind of got out in front of it and hadn't had to call and ask for forgiveness lately. So I'm very glad about that. I won't speak on behalf of the others, but I'm certainly grateful to Governor Lee for a reappointment in another 3 years to address this, because I told you guys when we first started, I think for me, it's the most important work I've ever done in my life. All right. Next item on our agenda is the community advocacy panel. And before Elizabeth gets started with that, first of all, this was Elizabeth's idea. So thank you for that. But way back when we got started, I put on the board, I put on the slideshow a recovery ecosystem. And in that recovery ecosystem were the parts that are basically the things that we absolutely have to have in order to build a system of care that people get the treatment that's right for them. And down in the lower left-hand corner, 5th of the 6 points was involvement of people with lived experience. And if you look at our council here, I think there's only one of us on here with lived experience. That would be myself, and I'm very grateful for that. But the lived experience I had was pretty highbrow. I tell people all the time I was born on third base and thought I hit a triple. Okay. I wasn't. I was stepped into a system of care that was designed to put me here. I didn't lose my job. I didn't miss a paycheck. I wasn't thrown in jail. And I was, really given everything that you could possibly need to have a successful recovery, including the people around me. Guys, that's not most of what our folks face. We have people in this room that have detoxed in jail, and the medical care they got was provided by their cellmate. We've had people that have suffered with substance use disorder, and the only thing that they saw was just continual punishment. And that's actually the norm. Now we've gotten a whole lot better at that through the years. Thankfully for some work done by, obviously Commissioner Williams and the department, as well as Ellen and Judge, but we still got a long way to go. And so when we start to look at input to this council on what's actually out there, I think, people with real lived experience that have been out there, in the recent past, I think is invaluable. So with that said, Elizabeth.
Thank you, Dr. Lloyd. And echoing what Dr. Lloyd said, is you all can see the first slide that talks about the purpose. And I'm going to get into the law, but also if you see the photo, if any of you if the council of course was there, but if any of the public was there, you remember the meeting where we had people with their photos of their children and loved ones who they had lost to opioid addiction. So just remembering that that's the core of the purpose. And we also want to remember the law here. So this is what I'm going to go ahead and read it. What is the purpose of the panel? In accordance with Opioid Abatement Law, TCA, Section 38, Chapter 11, Part 105A, the council is required to receive input from community stakeholders, local governments, state and local public health officials, public health advocates, law enforcement, judiciary representatives, opioid remediation service providers, and other parties, to include those with living experiences who are interested and actively involved in addressing the opioid crisis and its abatement. So I'm going to summarize this. If you look into your binders in the very front, you'll see the community advocacy panel proposal, and you can follow through with it. I'm going to read the whole thing, but I'm going to go through the slides. This is a summary. These slides are a summary of the proposal. So at the June 18th meeting, the council approved the motion giving Executive Director Mary Shelton the approval to begin the advocacy community panel in developing a process. So then in June 18th through September 2024, we began creating the proposal, developing it, the purpose, structure, operational functions, and the timeline, which you'll see in the document. Next slide, please. So what does this look like? What is the panel selection process? So the panel selection process is, if you, the Tennessee Department of Mental Health and Substance Abuse, the regional council map, if you see that to the right at the top, that map, we would select 2 members from each of the regions, which would give us a total of 14 members. And then the other 2 would come from affiliate state organizations such as NAMI, Tennessee Voices, and other organizations, that healthcare organizations that would be a part of to give advice and inform. How will panel members be referred and selected? The council members will receive referrals from the affiliate organizations just mentioned. And then how will candidates be selected? The office will review and compile a slate. We'll bring that back to the council to review and for discussion, review, discussion, and approval. And to the right, under the map there, the council map, you'll see the panel organizational chart. So that's what it would look like. You would have the 15 members from the council. Below that, you have, which would be myself, the program director. I would be reporting back to you all, come to the meetings, telling what's going on within this panel. And then below that, as you see the 2 members, the affiliate state organization reps, that would be the chair and co-chair, which is represented by those individuals that would be selected from Tennessee Voices, NAMI. And then below that, again, that is the 2 members from each of the regions. Next slide, please. So frequently asked questions. So when and where would the panel meet? So the proposal is for them to meet at least once quarterly via virtual format. So they would meet virtually. They are volunteering as well. They would meet in a virtual format. How would panel members, there's my slide over here. How would panel members be required to attend council meetings? Or would they be required? And that is yes. During discussions, during meetings, we talked about how it would be good for them to ensure at least one panel member attends each of our council meeting, so there's not any confusion, everybody's on the same page of what's going on. And then, since they're open to the public, any of the panel members would be able to attend the public meetings, of course. Would council members be required to attend panel members? It's not required, but it is recommended that at least one council member attends, and then one staff member, which would be myself, attending the meetings as well. Next slide, please. Okay, how will the panel be publicized? So the panel will have a designated webpage, which we've been working on that as well. So there'll be a designated webpage to receive the information, just like similar to our OAC webpage, meeting dates, virtual login information, historical quarterly agendas. The meetings would also be posted on Facebook, LinkedIn, and the X, formerly Twitter. Would panel members be provided orientation and training? That's yes, they would be provided training. Would there be any fees associated with the panel members? The council office does not foresee any fees associated with the meetings or the members. Next slide, please. And coming to the end, this is at the end of the proposal as well, the proposed timeline. So September is when we began the process. And as you can see, the different, for example, we started the implementation, and we're working on to the recruiting documents. A lot of the documents are being created at this time. So from September 2024 to August 2025, that would be the timeline to create the documents, do the selection process, and implement, have the first council or the panel members to inform the council on their work. And that concludes this slide.
All right, thank you, Elizabeth. And as we went over in the one-to-ones, we're not needing any approval from the council right now, but just want to make sure that we are aligned with y'all's thoughts, intent on how we are designing the panel. So any questions or concerns from the council?
If you don't mind,
Yeah.
Elizabeth, thank you for doing this, by the way. It's so much better than anything I would have put together for sure. How will people apply to be on this? I know we're developing an application. So in each of those 7 regions, how will they apply to be on?
So that we were putting documents together through FormStack that they would be able to apply online.
Right.
So
So they would have to know to look at the website. I guess how would they even know that this is a possibility for the folks out there?
So that we'll work with the departments of mental health like NAMI and different departments to get the news out. Also, just on our webpage as well, you all letting them know. So just similar to how we're letting people know about the OAC program at all, so we would just use that outlet. But if any ideas, that's what we're thinking, like, Twitter, Facebook, all the different social media outlets. But if you all have other ideas that may be.
I've got one idea right now.
Thank
Okay, and it's going to totally break with our meeting here. There are people in this room that are in these groups out there. We need you all to make sure that this gets spread through your social media accounts and everything you're in our community doing.
So yeah, we'll use our distribution list, which Debbie, are we pushing 800?
Yes.
We're pushing 800 on our distribution list. Also use the department's Facebook page. And then anybody else can, like Dr. Lloyd said, take the email and then send it out to your own list.
It's one thing I love about the recovery world. News like this spreads like wildfire. So I think we'll be able to get it out there. I just want to make sure that that's okay. And thank you, Elizabeth. I do want to, before we move on, I want to talk just quickly about need for representation on this coming from everybody. If you look at overdose deaths in the United States right now, we've gotten best news that we've had in years, right? I mean, Maria, I think there was a time that we didn't think we'd ever see a downward trend, but we're seeing significant downward trends. Matter of fact, bigger than would be predicted. And we're excited about that. But there's some groups that aren't included in that. And by that, I mean African Americans. African Americans still have an increasing overdose death rate, mainly African American middle-aged men. So when we're looking at this and looking at input, I would really like us to try our best to get representation from a wide variety and diverse group. I think that's important because I think some of those things that the Black and Brown community experiences are not consistent with what we've experienced, as whites. And so those of you out there that are listening to this, if you see this, please apply from those demographics. We absolutely need that input. And I've learned this, you can't just build it and they will come. You have to be intentional about recruitment. And I want to try our best to do that. So thanks, Elizabeth. All right, next up, Kurt, policy and planning.
Yes. So I thank you, Kirk, for coming to speak with us today. There was a motion by the council about a year or two ago to ask the Policy and Planning Council to come speak to the council, our council, the Opioid Abatement Council, once a year. So thank you, Kurt, for joining us.
Oh, thank you so much for having me back. I'm Kurt Hipple. I'm the Assistant Commissioner for Planning, Policy, and Legislation with the department. And before I get started, I want to thank our Vice Chair for the Statewide Planning Policy Council, Paul Puchkar. He's with CADIS down in Chattanooga, the Council for Alcohol and Drug Abuse Services. He's one of Tennessee's, he leads up one of Tennessee's premier substance abuse treatment programs, and he's a great vice chair. So please welcome Paul.
Welcome, Paul.
So we had our Statewide Planning and Policy Council meeting on Tuesday of this week, and that's a morning meeting from 10 to noon. One of the presenters realized that he was the only thing standing in between the council and lunch. So he made his comments very short and brief. We've already had lunch today, but as I was driving down here, I realized that I'm in a very similar position because TCA 3311 105B says, before rendering decisions regarding the disbursement of funds, the council shall receive input from the Department's Statewide Planning and Policy Council's needs assessment process, which is conducted with the assistance of 7 regional planning and policy councils. So, I mean, in a way, before y'all spend any money, y'all got to hear from me. So I'll get out of the way after this presentation. Statewide Planning and Policy Council, if you can see on the next slide.
Yeah, this one is delayed.
Okay, there it is. You've seen this picture before from Elizabeth's presentation, but we have 7 regional councils. These councils consist of the mental health and substance abuse service providers, consumers, and very importantly, the consumers and their family members, advocates, and other stakeholders. We have 7 regional councils, as you can see there, all the way from Memphis to Mountain City, 1 statewide council, which administers partners with several committees, including the Adult Committee, the Children's Committee, and then they partner with the Consumer Advisory Board, again, made up of consumers. Very interesting feedback and a lot of good work that board's doing. All councils and committees meet quarterly. Next slide. So one of the main activities of these councils is to conduct a needs assessment yearly. We do that, it gets published every year around April. So they are already starting to work on their needs assessments for next year, for 2025. Well, today, we'll go over the 2024 needs assessment and some of the highlights there. But basically, the department ensures that the most relevant needs are prioritized by asking the statewide and regional planning and policy councils to complete an annual needs assessment. Each spring, the 7 regional planning and policy councils, as well as the statewide planning and policy councils committees, that I mentioned before, Adult, Children, and Consumer Advisory Board, work independently and autonomously to identify and prioritize up to 3 mental health needs and 3 substance abuse needs. This link here will take you to our website, and it'll have the 2024 needs assessment summary, which has all the needs in it. But it'll also have a document that I'm about to go over on there that is the multiple region needs summary. The process helps the department in 2 ways, and I think it can help y'all in the same ways. The councils help identify regional needs and assets in order to influence the mental health and substance abuse system, and it provides a method for the department to target limited state resources to more effectively and efficiently meet the identified needs. All right. Next slide, please. Like I said, this should say 2024. That's the one we're going to go over, but this is the multiple region needs. My bad. I probably sent you the wrong slide.
Yeah, the title says 2023, but it's 2024.
2024
Yes.
needs assessment. And like I described before, these are needs that are identified by multiple regions or multiple committees. Okay, so this really gives us a good flavor of the needs that are impacting around the state. First, continue to increase funding / number of and access to residential services and detox beds for adults and children. This need was identified by regional councils 2, 3, 6, and the Children's Committee. And mostly the Children's Committee were focusing on adolescents. Matt Yancey came to our statewide planning and policy council meeting this week, and he gave an update on some of these needs. So I'll give you a little bit of flavor of what he said. He said in response to these needs, and there's always going to be room for y'all to augment these, supplement these efforts, but contracts have been executed to bring 156 new beds online. So that's great. Great. If y'all want to join us in that, please do. Continue to increase the next need. Continue to increase education and prevention programs for youth and adults. Regional councils 1 and 7 identified this. One of the things that Matt talked about was one of the focuses have been sustainability, making sure people who work in these prevention coalitions can get health insurance, that the administration, the leadership of those coalitions have training in how to administer a complex organization, providing internships for people to kind of train your next generation of leaders in those coalitions. Third, continue to increase recovery housing. Regional Council 2, the Consumer Advisory Board, and the Adult Committee identified this as a need. Something that Matt shared. Of course, Commissioner Williams was instrumental in bringing that program online. That continues to thrive and have a lot of great impact across the state. Another aspect of the housing that we're proud of is 18% increase in Oxford houses in recent times. Finally, transportation. Regional councils 1, 6, and the Consumer Advisory Board identified this as a need. As y'all know, the SOAR, federal SOAR grant supports the use of transportation with those funds. Also, the Criminal Justice Program, through their specific assistance awards, are helping people purchase bus passes or public transit vouchers, those types of things. But those needs are the ones that multiple regions identified, multiple committees identified. Try to give you a flavor of how the departments tried to respond to those. I'm sure y'all will come up with some great ideas about how to do that. And then I'll just lastly say that I've given my presentation. 'Tis the season to spend, and God bless us, everyone.
Thanks, Kurt. Not even sure how to respond to that. You might have any questions for Kurt? Kurt, I appreciate this. I don't think there's any shocks to us up there about anything. And as we look at this next round of grant funding, which I think the window closes today. Is that
That's right, yes.
Closes today. We need to keep this in mind. I mean, we don't have to go out and spend money on a needs assessment like other states do. We actually have this provided for us right here. We know what our needs are. We know what our needs in those areas are. So as we're reviewing those grant applications, let's keep those things in mind because all these things are part of a recovery ecosystem. And to the judges out there, I want to throw this out. Maybe somebody will throw a proposal in here one of these days. I'm working in another state right now as well. And one of the things that I have been blown away with is the Jobs and Hope program they have. And as part of that, and folks that we're trying to reach, these were programs that they would step into with regards to jobs. But one of the things they do in their Jobs and Hope program is help people get their driver's licenses back. And that may not sound like a huge deal, but before I started doing the work that I do now, I thought most people who went back to jail for violation of probation went out and committed another crime. For the most part, they don't. I see a bunch of VOPs, and most of those VOPs are traffic violations because somebody's driving without a license and failed to signal a lane change. Instead of getting the ticket, they go to jail. And so, the proposals that are, maybe somebody's out there thinking about it. I don't even know if this is okay right now. I don't care. We need to be looking at that. We need to be looking at ways, programs to help people get a driver's license back, because if you're going to have a job, you're going to need transportation to that job. And it's really hard in rural communities to have bus service and everything else. Now, there's some really neat things going on in Putnam County with regards to that and some innovative things that I think people are, matter of fact, I think a proposal will be before this council from them. But those of you out there listening, these are areas of need. And whenever you restore somebody's driver's license, it is a big deal. And the downstream savings with keeping them, arresting them, putting them in jail, and you're also interrupting their recovery cycle when that happens, putting them at risk again. So that's just my 2 cents worth on that. And Kurt, thank you as always. All right, Mary, fiscal updates.
All right, thank you. First up, an announcement. We've received word from the Attorney General's office that there are 2 additional settlements. Indo has settled, and we received their payment in October of $8.4 million. And then also Kroger has settled, and we expect to get $30 million over the next 11 years. So good news on that front. Skip Sam.
I won't get back to it.
Okay.
Yeah, that's all right.
We just texted.
No, tell them I didn't forget it.
We didn't forget you. We'll come back. Sorry. Thank you. All right, next up, at each meeting, the OAC office will share the current monthly opioid abatement trust fund statement. And please note that this information was current when we created this. So this is at the end of October, and so small. 206,332,496. Net cash available, $206,180,222. All right, and I'm going to turn it over to JP again to talk a little bit about OAC administrative expenses. These are questions that both the office and council have had. So JP.
Yeah, I'll keep this very brief. We looked through the statutes, and having been involved on the front end too, we know that the administrative expenses incurred by the council are eligible expenses to be reimbursed from the trust fund, and that was anticipated by the settlements as well. So not only the disbursements to counties and grant recipients, but also the administrative costs of the council can be taken from the fund.
Any questions from the council for JP?
And Shane, I don't see up on the screen, but I know you're there. I think this was a question you had at some, at one of our previous meetings. I just want to make sure that, that answered your question.
Yes. Yes.
Thanks, Shane.
Right, and we have two slides on administrative costs. And so since now we have an accountant on our staff, which we're very pleased and happy to have, so you don't have Mary Math. Melissa, can I turn that over to you? So she has two slices on this.
Thank you, Mary. I hope I can compete with Mary Math. So I just real quickly did two formulas on our administrative expenses. The first one is the total administrative cost that we've, since the OAC was started, is 2.6 million. And if you divide that by the total revenue we've received, just over 272 million, we are at just under 1%. That includes program staff time, our contributions to the department for Edison, HR, IT, those sorts of things, as well as software that we've spent. Next slide, and these numbers are as of October 31st. Again, our administrative expenses are the same at 2.6 million. And this is divided by the total expenses for the OAC office. So this would include the county expenditures that we've made, as well as the community grant payments. So if you look at this ratio, we're at 3.92%. As we spend more money and make more payments, that number will decrease, but that's where we are right now.
Thank you. Any questions or comments from the council?
It's okay. I'd like to ask Marie a question. Marie, looking at us, how do we compare to the department?
I'd like to answer that. I was saying how you compare to the rest of state government and then to the department.
You bet.
So one of the things that we have prided ourselves in is the ability to have low admin cost in the department. We are one of the lowest admin overhead departments in all of state government with a 6% overhead. So this is awesome. And I know for those of you that are in business, like my family, you're like, what the heck? It's pretty low overhead. And for those of you that run nonprofits, Brian, you and others, this is really, really low overhead. So if you compare it to all other, whether it's private, public, it's really incredible what y'all are doing with that. Thank you for asking.
Thanks, Commissioner. Somebody else have any questions?
So the actual administrative costs, did you put the count?
Part of our total expenses, the county payments and the community award payments.
Okay, I didn't know if we had to administer those since we have no control once they go out. Okay.
Our office.
All right.
Yes. Yeah.
All right, thanks, Dr. Cornett. Dr. Jackson.
I just, I have a comment about the positive prediction that this number will go down as we spend more. I would agree that, mathematically that is correct. However, one of the reasons about my question, one reason behind my question about the SMART funding is that's 1.3 million a year. And remember that our disbursements were front loaded. This first round of grants was a much larger pot of money than we're annually or every 18 months going to be handing out. And so if we were taking on a 1.3 million per annum expense, and we're putting out, say, 18 million over 18 months, that's a 12 million per annum disbursement. And so that number is closer to 11% administration per annum. If I understand these expense reports correctly, this is in total, and per annum, we can expect our administrative percentages to rise over coming years. And I'm concerned about that. I want to see this number definitely stay below 10%. I'd like to hit the Marie line, 6% or below, as we mature into an ongoing thing.
Thanks, Dr. Jackson. DP, I guess I have a couple of questions for you, and kind of dovetails a little bit with what Clay was just talking about, the Endo settlement, does that mean that Endo has paid us in full?
I would have to get with Michael Leftwich on that. He's on the consumer side, but happy to get that information for you and report back.
All right, thanks, JP. If you remember our very first meeting when AG Slatery gave us our charge and then went down to disbursement and where the money came from and where it's going to, our percentages, this money is going to be staggered over 18 years. We're now almost 3 years deep into that. And we have settlements. Some of them were paid up front. I think McKinsey or somebody paid theirs in a lump sum up front, and then others are coming in incrementally over that 18 years. And so that was the reason for that question. The other is, and I think I know the answer to this one, is that the full amount that Kroger is going to pay? According to the newspaper, it is.
Yeah, that's my understanding as well, but I don't want to say with any definitiveness that that's true without talking to him first.
And this, I got the information from Michael, but yeah, we'll follow back up with Michael and make sure.
And Dr. Jackson, I appreciate what you said. We do want to see that number, be where it needs to be, all right, for us to be able to get our work done. I think we're pretty much fully staffed. I think we did one position you talked about earlier.
Yeah, I'm going to ask for a position.
And I think that, looking forward, and this is outside the scope of this meeting, but, there are lawsuits out there that are going to be coming forward in other areas that have not been, called to the mat yet. And I won't comment on them publicly, but I do know that those are in the process of taking shape right now. And so I would anticipate if they go the way the others have, that we could be looking at other settlement dollars reaching us if our General Assembly sees fit. That's just FYI. Does anybody else have anything? All right, Sam, if it's okay, I'm going to break here and go back to Sam so we can clear up the question on our minutes from I think it was our October meeting. So Sam, do you mind?
Sure. So Mayor Moore raised a motion, exactly as it was written on the screen or presented by Mary. So it was, the motion was to allow the executive director to engage in contracting negotiations and or execute a contract with Smart Initiative for at least 2 years to assist counties with allocating and spending. That motion was seconded by Shane Sexton, and then the motion carried after discussion.
All right, Sam, what does that mean?
So it means exactly as it was written. The executive director, Mary, has the authority from the council to engage in contract negotiations with Smart Initiative. That could mean multiple things. That could be, the contract term, the term being 2 years, at least 2 years, and use that to assist the counties with allocating and spending the money that they've received. So,
So Sam, Mr. Chairman.
No, absolutely, Dr. Jackson.
As this motion has been voted on by the council, because it says or, this motion does not obligate us to enter into a contract for 2 years with Smart currently. That ship has not sailed. Am I understanding that correctly?
I'm not the attorney, JP.
And Sam comment as well, but until there's a contract, there's nothing binding at all. So the way that's written, authorizing Mary does not, there's nothing binding the council at this moment to that.
I know Smart's on the agenda later, and I don't want to tie this all up, but this is related to the admin costs. And I have a burr in my saddle about this. And the burr is that we are going to tote the note for the admin to help the county spend their money. But under the current state law and how I understand this would work, the counties would then not spend a dime of their allocated money to support the admin that's consulting them with how to spend their money. We would do that. But we would be bearing the admin costs for the 35%. It's not being wasted money. I think SMART is a wonderful organization. Full disclosure, I've done 2 podcasts for them and I happen to like them. Okay. I don't have any W-9 relationship with them, W-2 relationship with them, or 1099 relationship. I have a you are nice people relationship with them. I think they do great work and I think they are fitted for this job. I just have a fiscal issue and philosophical issue with us taking funds that are part of our, it's really not 65% by the time you cut it all. I think we're responsible. Honestly, I think we're responsible for allocating around 48, 49% if I did the math right. But now we have an accountant. She can tell me which way it goes. But for us to pay for the consultancy out of our pot, for them to be consulted on how to disperse their pot seems unfair to me. And my spleen is now vented. May you be blessed.
Absolutely. Dr. Fournette. Dr. Fournette.
I had the same concerns and I talked to Mary a little bit about them. But then the last meeting, my understanding was there is no way for the counties to pay out of their funds administrative costs. Is that not incorrect? Admit that the counties had no way to pay any administrative costs out of the funds they were distributed.
I will let Sam weigh on this if he wants to, but Sam has explained this to me this morning. So I will tell you what I think I understand. That is this. Public chapter that created this commission and this fund from the state legislature does not contemplate a mechanism for counties to, it doesn't speak to their paying administrative costs. But clearly there are 2 sections of that public chapter that do allow for administrative costs to come out of the opioid abatement funds. Clearly. We just ain't, and I didn't pay. So that's coming out of the opioid abatement fund. So admin costs can be taken out of those funds. Not everything has to go to Narcan or bids. The sticking point would be getting the counties to do it. What has been explained to me by our legal counsel is we don't have the authority to tell the counties how they can spend their 35%. We can give them all the free advice they want to receive, and they can pay for it exactly what they want. But we could encourage them, and we could say, hey, we've noticed you're not spending your money. And we're getting a lot of requests from you about how to spend your money. We got a great program for you. It's going to cost $1.3 million a year. You're getting X million a year. How about you, Putnam County, Cotton County, Shelby County, Hamilton County, all of you get together, and you guys, if you're getting X dollars, you spend a percentage of that to fund this SMART initiative, which can advise you. We could give them that suggestion. They could tell us to go take a hike. I would like to give them that suggestion because it seems fair.
That's no Jackson.
Is your real worry that the percentage goes up because we're footing that? Is that a worry for you?
It is. I want to keep our admin costs up. Now, I realize in totality, the money's not going to yachts. It's not going to wasteful things. And I realize to some degree, it's a red plate or a purple plate. You know, it's all coming out of the same global funds. It's all going to good fiduciary, responsibly, fiscally wise things to do. Yeah. To consult busy county commissioners on what to do is a good thing, I believe. Yeah. I just like for it to come out of their pot of money. I just philosophically, I'd like for it to be that way. It may be impossible with our structure. I appreciate that, but I'm here to represent people sent me here, and that's what I'm trying to do.
So the accountants, you're going to be able to capture how much it's going to run to do this. And can we have 2 different overhead costs with that included and without that included, and just tell us how much each is?
Yeah, if you look at the ratio, if we pay for it, it affects the top number, the administrative expenses. If the counties pay for it, it affects the bottom number. Our percentage, that's how the percentage will be calculated. So if we increase the top number, that percentage is going to go up. That's what Dr. Jackson wants to happen. If we increase the bottom number, it's going to go down. What happens if the counties pay for it?
Yes, that part I actually understood.
That makes sense.
Yes, thank you.
Dr. Lloyd,
Yes.
could someone tell us what, again, do you remind us what they would do for the counties?
Are you talking the SMART initiative?
Yes.
Okay. Mary?
Right. I was trying to decide if I had a slide. We have a update on that, but they're going to be consulting with the counties. Here we go. They have submitted a scope of work. They're going to also be reporting back to us. And we are looking at the scope of work, but essentially they're going to be reaching out to the counties who are needing assistance with how to spend their funds that are coming through us, helping them set up that structure, consulting, educating.
Got it. So to your point, this is something I hadn't thought about. It's an interesting way to look at it. Do we know if the counties even want to talk to someone about how to spend their money? Or are we assuming that this is the way to go? Did anybody talk to the counties?
Yes, we talked to David Connor.
And he's the county association.
Yeah, he's the county association at ED, and he actually recommended, along with a couple of other folks that were at the meeting, recommended us working directly with Smart Initiative, since they already have built rapport with the counties. They have the scope of work.
That's helpful. Thank you.
You're welcome.
I'll give just a tad bit more background on that. There are also some entities outside of what we're talking about that are approaching these counties, say, hey, we'll help you spend your money for X amount of dollars. All right, and looking at it as an opportunity to make money from this. And I think that's where we got very interested in what the SMART initiative can provide, because of the relationship that already exists, and it's one of the 5 core missions of the University of Tennessee system. And so that was the reason behind that. So Clay, I definitely understand what you're talking about. Where do we need to go from here? What would you like to see?
Can I ask one more question before he responds?
If that's okay. Yes, ma'am.
If we don't use that money for that contract and the county takes it over, then does that money go back into the pot for this committee, council, to give out in service dollars? I would, because it's part of our pot, right?
Yes. Yes.
So basically, the money go over to the counties, if they wanted to do it, and then that 1 point, what is the amount? I'm sorry.
1.3 million.
1.3 million. Okay, I just needed to ask for clarification on that. Thank you.
JP, you look like you had a burning desire there.
Respond.
I thought I was being asked the question that was already answered.
Yes.
Can I ask a question? What percentage of the counties have drawn down their dollars to this point? Do you know that right off?
Yeah, it's right here.
Great.
We're getting there. Oh, I went too far. Hold on. It's right here. So we have dispersed 61 million. Oh, my microphone's not on. We've dispersed 61 million, Ella. Is that right? 62 million, and 12.6 million has been spent. So as Ella and I were looking at the reports coming in from the counties, seeing that they're not spending their money, needing assistance, went to talk to David and other folks from the county folks. They offered this up as a solution, and then we brought it to the council meeting last time for y'all to review and vote on.
Again, with them being dispersed 60 million, if they fully funded SMART at 1.3, they still be at 6% admin rate. I'm not an accountant, but it's reasonable. So what I'd like to answer your question, Mr. Chairman, what I'd like to see is, I don't know if we can call it a working group. I still don't understand how many of us can talk at a water cooler without it being in violation of sunshine law. What has been said to me repeatedly is that we may do fact finding. We may have discussion. but we may not have substantive deliberation that leads to actionable items between meetings. Did I do okay?
That's great.
I can be tall. I'm married. It takes a while, but I get it. What I'd like to see is our executive director. I'd like to see David as a county representative, potentially the chair or a designee. 1 or 2 board members have a 3 to 4 person huddle between now and the next meeting and advise council as to whether there's a path forward. If David thinks that the counties would take a bite on this to do what I view as their fair share of toting the note on their admin consultancy. But for the record, I think Smart's fantastic. I think they're wonderful people. And unless Marie knows better about the state, I think they'd be good for this. I think they would help the counties. I don't have a problem with the amount. I don't have a problem with any of that. I just want to come out of the county bucket instead of ours, out of fairness and transparency about who's getting the benefit. Because that 1.3 billion is not buying Marie another grant analyst. It is not getting us a quality director to look and make sure people are not spending this on bass books. So if it's going to the counties to help them, I believe it ought to come out of their pocket.
Understand. So what we have on the table right now is we need to take care of the minutes. And then I'm assuming somewhere in there is a motion that we need to revisit after we take care of the item on the floor, which is the minutes from the October meeting. Is that correct?
I move, Mr. Chairman, that we take up from the table the previous motion to approve the October 28th.
Okay. Do I have a second?
I'll second that.
All right, second. Any discussion? All right, Mary, we'll proceed with the roll call vote. Actually, before you do, Clay, do you mind restating your motions?
Wait, is this the motion to approve the minutes?
No. That motion has been made and tabled.
Okay.
We must now have a motion to remove it from the table so that it may be considered.
That's all right. We've got to untable it before we can address it, according to Robert's rules. So that's where we were. All right. So, Mary, if you'll proceed with the roll call vote.
Armando Fontes,
Yes.
Ron Bud,
Yes.
Casey Cox,
Yes.
Clay Jackson.
Yes.
Karen Hershey,
Yes.
Lisa Tipton,
Yes.
Mike Flynn,
Yes.
Shane Sexton,
Yes.
Becky Vanderpool,
Yes.
Steve Lloyd.
Yes.
Tim Cornette,
Yes.
Tommy Farmer,
Yes.
and Wyckoff.
Yes.
All right, the motion carries. So we have untabled our motion and now we can, all right, untabled our the October 28th meetings now, or minutes. Now we can address it. Do we need to change anything in them? I don't think that we do, but do I have a motion to approve these?
Well, we already have a motion, Mr. Chair.
Okay.
Point of order. We have a motion. So if there's no further discussion.
Can we clarify, I have a question. Can we please clarify what the final assessment was from the minutes? I apologize if I missed it, but was it that the minutes was stating that we were to negotiate with Smart Simple? And are we including that in our acceptance of the minutes and then amending it to what Clay suggested, which is the working group? So in other words, are we accepting the minutes as written, or are we saying we accept the minutes as written and we plan to make an addendum to what was previously accepted? I'm just trying to clarify. Didn't mean to stump everybody, sorry.
I think we lost the feed.
Maybe my question was too complicated.
No, I think yours made sense. I think you would accept the minutes as written, and then you would have another motion to.
Right, am I gonna get feedback?
Can you hear us?
Network makes down, but
All right. Why
Hey.
can I not hear you? Because you're not turned up. All right, Sam, can you hear me?
I can hear you.
I
We
can hear
lost
you.
y'all.
We
Yeah,
lost the video.
Yeah, the link, something happened to the network. We've called our network person.
So the question was, do we? Oh, there
Yeah,
is a few pipes.
I'm sorry, Stephanie, hold on just 1 minute. Do we want to go in and take a break?
Yeah,
while we
let's
get-
go ahead and take about a 10-minute break
Right,
and
we're gonna-
get this straightened out.
Hey, guys, we're going to take a break while we get the network issue fixed.
Okay, thanks.
Yeah.
Our folks, and we're going to email our folks who are out there wondering what's going on to update them, and as soon as we're back up and running, Elizabeth will let us know. So I'll go ahead and call our meeting back to order. And we were about midway through our vote on approving the minutes, I think, Mary.
Oh, yes, that's what we were doing. Okay, so I left off at Lisa Tipton, Mike Flynn, Shane Sexton, Stephanie Vanderpool, Steve Lloyd.
Yes.
Tim Fournette,
Yes.
Tommy Farmer, Wayne Wyckoff.
And
Yeah, Wayne.
Yep.
Okay.
Yeah, Mr. Wyckoff is in the affirmative, so the motion carries. Now, Dr. Jackson, would you care to state your motion?
I move that the chair appoint an exploratory committee to examine facts as to whether there's a mechanism for counties to participate in the funding of the SMART initiative, to consult them in the disbursement of their received funds.
All right, I have a motion on the floor. Second. A second by Dr. Fournette.
All right, can I get the details of this? I think at one point we wanted to type it out. Can I make sure that I have this?
Yes, ma'am.
Hang on.
Here's that.
Here we go.
Okay, so 1 second, Lisa, let's make sure you're ready. Do you want to talk before you restate it, Lisa?
If I could.
Go ahead. No, absolutely, Chair. I recognize Ms. Tipton.
Thank you. I apologize for being late coming back in. So I just need a little bit of clarification. So when we're talking about this being a service available to the counties, would the counties have the opportunity to choose if they want to pay proportionally by the percentage this initiative would cost if they want to pay to have that service? Will they have the choice?
They'd have to. The law does not allow us to mandate it.
Okay, so this would be a voluntary service offered to the counties if they wanted to pay for it.
That's correct as I understand it. Public chapter that created our commission does not give us the authority to tell the counties that they have to pay an administrative fee.
So would the entity that we're talking about, are they okay with that? Because
We don't know. That's what the committee's for.
if the price tag is, say, $1 million, if we say it could be 800,000, it could be 400,000, depending on to what extent the counties opt in.
What I would envision, Lisa, is that we'll go to the committee. David will go to the counties. He'll take their temperatures, whether they're willing to foot their part of the deal. We hope everybody ponies up. If they don't, we wind up with 600,000. I would imagine that we're gonna have to come back and get 800 would have to come out of our bucket.
So nothing will happen until the committee finds out that information, then we come back to the council and say, here's what we're looking at. Here's what the business would take. So we need to decide how we're going to proceed.
The only hammer we have is if the county's gone too long, the money reverts back to us. There is a mechanism for that. And so then we can take that money and say, okay, well, that's going smart. I mean, we can apportion however we want. But we don't have a hammer to say, you're going to participate in this program. That's going to be soft power, and that would be David's convincing of them that this is good for them. Whereas, as our chair said, there are multiple companies or third parties that are advising counties, entities, nations, tribes all over the country about how to spend their money, as many of you guys are well aware, more aware than I am. But yeah, it would be voluntary. My motion suggests to the chair that he appoint 3 or 4 people to have a committee to explore this and report back to us at the next meeting. Again, we can't go 2, 3, 4 quarterly meetings and have any substantive impact on this, because if the counties don't spend the money, it's coming back to us. And so if they're gonna spend the money, we gotta get smart or somebody in place to advise them in relatively short order so they can spend it on their cycle.
And the long and short of it is, I think that this is the best way to go for the counties. I mean, it's a better deal because I've seen at least two counties that I know of that have contracted with outside agencies, and it's for more money than we're talking about here, substantially more. So Lisa, it's the motion that Clay's getting ready to state, that's what it would do. This, I guess, committee of sorts would bring our findings back to this council, and we'll decide how to proceed from there once we take the temperature of the counties to see what their appetite for this is. And so Clay, if you want to state the motion so Mary can get it down and we know what we're doing, and then we'll move from there.
And before that, just to be clear, Lisa, a working group can't do any substantive deliberation. So the discussion is gonna happen here, has to.
And I really appreciate that. So I just wanted to be clear that it would be the county's choice.
Absolutely. It is. We have a mechanism to take their money back if they don't spend it. We don't have a mechanism to tell them what to do. As long as they stay in the categories.
Right. And Commissioner asked earlier if the counties, if the counties had asked for this, or were they looking for direction? And the answer to that, Mary said is yes. And they've been doing it actually since they first figured out the money was coming to them. So they've been confused about this one. There's some county mayors that have been out in front of the others. And then when it comes right up to mind is Hamilton County. And with Davidson County, but they had really good people advising them. Some of these rural counties don't have that. And so I think it's a need, and I actually think it's the most fiscally responsible way to go about it is how we chose them. So Dr. Jackson, if you want to state the motion.
I move that the chair appoint a working group to explore opportunities for the counties to pay the consultancy fee of the SMART initiative and report back to the full council at the next scheduled meeting.
All right, we have a motion on the floor. Give Mary just a second to.
Right, Clay. Does that work? I'm fixing to type those.
I make a motion.
B. Instead of consulting pay, it's consulting fee.
Okay, yeah, look at the big monitors.
Yeah,
The small one takes a minute.
Smart initiative.
Initiative.
Yeah, sorry, spelling initiative on demand is. Okay, how does that?
But did you have all that?
I have a friendly amendment from Dr. Fournette who suggested after scheduled meeting or next emergency meeting if feasible.
And that amendment is acceptable to you.
Oh, yes, sir.
So we have the motion and an amendment been accepted by the motioner. I would like a second. A second by Brian Buck. Any discussion? If you would proceed with the roll call vote, and I think we have our folks back online. Sorry, guys, the entire county went down for just a little bit. We didn't selectively exclude you all.
Armando Fontes,
Yes.
Brian Buck,
Yes.
Casey Cox,
Yes.
Clay Jackson,
Yes.
Karen Pershing,
Yes.
Lisa Tipton. Yes. Mike Flynn,
Yes.
Jane Sexton,
Yes.
Stephanie Vanderpool,
Yes.
Steve Lloyd.
Yep.
Tim Fournette,
Yes.
Tommy Farmer,
Yes.
and Wyckoff.
Yes.
All right, the motion carries, and I will exercise that. I'll out to the folks I'll ask to do this. And we're not doing these things in the past, and I greatly appreciate it.
Can I ask an operational question?
Absolutely.
Okay, so given the motion that is for the executive director to engage in contract negotiations, do we continue with those contract negotiations?
Yes. Yeah.
Okay, all right, thank you. Thank you.
All right, Mary, you're still on the hot seat. So RX Summit and Quality Director position.
Yes, 1 second. Let me scroll, I'm scrolling. Okie dokie. Okay, the RX Summit is going to be held in Nashville this coming year in April. And then also I've got some insider information from Tommy that it sounds like it's going to be here for a year or two later. But this is an amazing conference. I've attended several years. I've presented a couple of times. I'm presenting again this April. Steve and I presented last year. But it's a great opportunity to learn more about the impact of the opioid epidemic and interventions from treatment, prevention, law enforcement, and advocacy partners. So the question to the council is, would the council like to support a couple or however many council members to cover the expenses to attend the conference in Nashville at the Opryland Hotel? So just wondering if the OAC would consider a motion to allow, and I've got two, it could be however many the council would like to support to, for members to attend the RX Summit paid for with the OAC funds.
Yeah, and just FYI to the council, I will be going. I attend almost every year. I've missed very few over the last decade, and I'll flip my way. So I don't have a problem with that. It's actually better than being in Atlanta. It's here in Nashville. This is, to my knowledge, this is the largest interdisciplinary conference around opioids in the country. Before the pandemic, the sitting president always spoke, and that hasn't been the case since the pandemic. But the quality of presentations and the programs, I can assure you, is outstanding. It actually was started by Representative Hal Rogers in the Eastern District of Kentucky, and then it's morphed into what it is today. So it'll be worth your time. So I'll maybe willing to entertain a motion. I just wanted you to know I'm going, so don't include me in that. I won't put forth the motion, but I think it would be more than reasonable for us to allocate funding to have at least two of our council members attend this meeting. And at some point, once we get our advisory board, I don't think it would be a horrible thing to send one of our advisory council to this meeting as well.
I make that motion that we pay for this.
All right. So for two of our council members and one of our advisory panel for a total of three.
Yes.
All right, a motion on the floor for Mr. Wyckoff that this council will support the attendance of two of our council members and one of our advisory panel members to the National RX Abuse Summit held here in Nashville in April. Do I have a second?
I'll second.
Second from the Sheriff. Thanks, Sheriff. Any discussion? All right, Mayor, would you proceed with the roll call, please?
Armando Fontes,
Yes.
Brian Buck,
Yes.
Casey Cox,
Yes.
Clay Jackson,
Yes.
Karen Hershey,
Yes.
Lisa Tipton,
Yes.
Mike Flynn, he was having to leave early. Shane Sexton,
Yes.
Stephanie Vanderpool,
Yes.
Steve Lloyd,
Yes.
Tim Fournette,
Yes.
Tommy Farmer,
Yes.
and Wyckoff.
Yes.
All right, the motion carries. Thank you all. All right, Mary, our quality director.
Yes. All right, I have a proposed new position that I'm bringing to the council this afternoon. And that is for a quality director to join the OAC office. Got outlined here some of the top job duties to lead and manage the outcomes reporting plan from the community grantees, refining the process and performance measures, providing technical assistance around data, focus on the impact of the community grants, synthesize the monitoring information, the outcome measures reporting, and the spend rates, provide real-time quality checks and assess risk relative to the state comptroller audits, and then manage the SaaS contract. And, you know, since Sean started, he and I have been talking, there are several times throughout the week where we're like, oh, it would be great to have a person dedicated just to quality to focus on this issue or that content. All right, so a little bit more about the position, requesting one, and then we have the salary range, and then the position will be located in Nashville, and we would use the Chief Quality Officer state position. And then just giving you an update on how many office staff there are at this time. and asking if the OAC will consider a motion.
All right, thanks, Mary. Does anybody have any questions for Mary around this position?
No questions on the position, but Mary, I think we lost your screen share. I'm not seeing it, or maybe I'm missing it. Can you make sure it's being shared with the group, please?
Yep. Let me do this again. All right, can you see it now, Stephanie?
Yes, now I can.
Okay.
Thanks, Dr. Vanderpool. We'll take questions or a motion.
I make a motion, we consider, go ahead, Stephanie.
Nope, you do it, Shane.
Okay. I'll make a motion that we consider that we create a new position of quality director under the terms as was set out in the by Mary.
Second.
Motion put forward by Judge Second, seconded by Dr. Vanderpool to begin the search for a quality director. Is there any discussion? All right, hearing none. Mary, if you'll proceed with the roll call vote.
Armando Fontes,
Yes.
Ron Buck,
Yes.
Casey Cox,
Yes.
Clay Jackson,
Yes.
Karen Pershing,
Yes.
Lisa Tipton. Yes. Mike Flynn,
Yes.
Shane Sexton,
Yes.
Stephanie Vanderpool,
Yes.
Steve Lloyd,
Yes.
Tim Fournette,
Yes.
Tommy Farmer,
No.
Wayne Wyckoff.
Yes.
All right, the motion carries. All right, Mary, the comptroller performance audit update.
Yes. All right, we're the wrong way here. Okay, so Steve and I presented at the Joint Government Operations Committee on October 15th with Chairman Paul Rose presiding. So the performance audit that the comptroller conducted, there was one finding, which was the need for written policies and procedures, and one observation of not implementing a consistent method for calculating county disbursements. So I reported that progress was already being made towards correcting these issues with the addition of the senior policy analyst, which is Marie up here, and then the addition of the accountant 3, which is Melissa, who we've heard from. And after the end of the hearing, the subcommittee recommended and approved a 4-year extension of the Opioid Abatement Council. So that will allow us to continue operations through June 30th of 2029. And then I have a screenshot here, part of the corrective action plan that we have submitted to the comptroller's office to show the progress that we are making towards developing policies and creating a consistent method for determining county funding. And Steve, I think you wanted to say a couple of things.
Trying to remember what I want to say. Must not have been very important. Well, no, the thing that I do want to bring forward, just, taking the temperature of this council in the time that we've been together. Sometimes I know we sit in here and we look and say, we're adding this position or we're adding that position, and we kind of get fancy about building our own bureaucracy. But when you get in front of your legislature and you're asked pointed questions about an audit that was surprisingly gentle, it certainly, these positions are needed. I can tell you that for sure. We took a couple of these, they were minor ones, but this council, from the very start, placed importance on getting funds into our communities to help hurting people. And I'm still glad we did that. I think it was the right thing to do. But then we've got to come back and kind of sew up some of the loose ends that we had. And having, it's going to be a big part of that one already. And then, with our quality director, I think that, we're definitely where we need to be. I understand the concerns. I share them like everybody else at this table. But whenever you're in there, and right before Mary and I, it didn't go so well. And Mary and I were very grateful that we weren't part of that group. And we certainly would like to not be part of that group going forward, if you know what I mean. But we did come out of there with one thing that we did need, which was a 4-year extension on our own existence. So Mary and I did not, drive us into extinction. So we were glad about that. So Mary, I appreciate the work. Does anybody have any questions around the corrective action plan? I don't know what font that is, but it's.
It's tiny.
Is it that way on purpose?
No,
It just signed at the bottom.
It's just so, and I can share the whole corrective action plan with the council, but I was just trying to make a screenshot so that y'all could see it. Okay, so leading off of that, we have policy updates. I'm very excited about this. So our senior policy analyst, Marie McGraw, she has already drafted upwards of 10 policies. And let me tell you, this is a lot of back and forth, and many thanks to the OAC office staff, to Sam, to JP, to the council members. There's a lot of review, edit, revision, rinse, repeat. So we are bringing 2 policies to the council this afternoon for review and discussion. The first one is the policy on policy management, and the second one is the communication policy. And you have copies of both of those at the front of your binder. If you want to pull those out, you can look at those. And here, and for those that are participating, for the public, I will be posting these on the website this week, along with the community advocacy panel document. And I mentioned this to the council members in their one-to-ones. We definitely would appreciate any edits or revisions on these policies. But if it is okay with the council, I'd like for y'all to approve a clean copy. So if there are any edits, we will take those back, revise the policy, and then bring that policy back to the next upcoming meeting.
Dr. Jackson.
Just a question on this policy regarding policies, which I find humorous.
You're welcome.
We're national adjacent today. Segment 4.1.5. When we need to make a change and we need to make it quick, the exec director and the chair can make that change. But at the next scheduled meeting we have, we vote that up or down. You can operate according to that change for a few weeks, but we get a chance to say no if we don't like the change y'all made, right? 4.1.5,
Yes.
it's on page 2.
Sam, are you hearing Clay?
I'm hearing, but I don't have the policy in front of me. Let me pull it up.
Clay, I'm going to make sure I'm in the right place. Under 4 procedures, 4.15, 4.1.5.
Yes,
okay.
Okay, I've read it. Can you give me your question again?
Question is, you guys have authority, the 2 of y'all between meetings, make technical changes or not substantive stuff. But if you do make changes in the policy, the wording, et cetera, whatever y'all decide between meetings, we'll come back to the full meeting, full disclosure. We get to say, that's a great idea, or what in the world did you do?
That's my interpretation.
Mine as well.
Okay, I'm happy.
Sam, did you get a chance to look at it yet?
I haven't. I apologize.
It's okay. I think we got JP. JP is good with it. That's one lawyer, so I feel good about that. So if it's okay, I guess we can move on unless you have unless you read it and have a different opinion. So Clay is good with that. Does anybody else have any questions concerning the first policy? And I agree with Clay. A policy on policies and procedures is I find it's from the Department of Redundancy Department. But I was on the VA, and I was the chair of the committee that oversaw all the other committees. So I've got some experience in this area. All right, we'll entertain a motion. So moved. A motion by Brian Buck to approve. Do I have a second?
Second.
Second by Sheriff Fontes. Any discussion? All right, if you would proceed with the roll. I'm sorry.
And this is a motion for both policies?
Well, I thought that was the first one. I want to take them individually.
Oh, okay.
I get scared about coming back.
Nope, that's okay.
Okay.
All right, Armando Fontes?
Yes.
Brian Buck?
Yes.
Casey Cox?
Yes.
Clay Jackson?
Yes.
Karen Pershing,
Yes.
Lisa Tipton,
Yes.
Mike Flynn,
Yes.
Shane Sexton,
Yes.
Stephanie Vanderpool,
Yes.
Steve Lloyd,
Yes.
Tim Cornett,
Yes.
Tommy Farmer, he had to drop off early as well. Wayne Wyckoff,
At the risk of being redundant.
Yes. All right, the motion carries. And I don't think the second policy has the redundancy. Well, maybe it does. Mary, you want to talk about it?
yes, the communication policy. So, so one thing Steve and I have been talking about for a couple of years is how can we be transparent and how can we make sure the public knows what is going on? And a lot of things that we do from day to day are things that are in my mind. And so I want to make sure that everything that I have in my mind is put into a policy so that I'm not in this position, or also to hold myself in the office accountable. So this is how we want to ensure transparency and communication with the public.
Oh, I'm sorry, Dr. Jackson.
Mr. Chairman, 4.1.4
Yes, sir.
is the intent for just to be reviewed twice a year or once every 2 years.
I will ask Mary and
Biannually, is that twice a year? Biannually is twice a year.
Yes.
I would change that to semi-annually, as biannually is an ambiguous word. Some people refer to it as twice yearly, and some people refer to it as once every 2 years.
Got it.
And given its ambiguity in English language, I would suggest we just change it to semi-annual, so it's clear.
Okay.
anything else? I see a few people still reading. I'll give you time to finish.
Hey, Mary,
Yes. Yes, Sam.
for what it's worth, I read the other policy. Agree with everybody.
Okay.
All right, thanks, Sam. All right, we can,
You lose them again? Oh, no, they're back. Okay. Sam, can you hear us?
Yes.
Okay.
yeah, just in keeping with what we laid down earlier, it's kind of group conscious. We'll make that correction and bring back a clean copy, for our next meeting, or we can address it at an emergency meeting if we have one in the interim. All right, thank you, Mary. I guess when I look at the communication policy, I'm grateful for the Open Meetings Act, because that saves us a lot of grief. And I'm very grateful for that, because I've been in a couple of states that don't have that, and that's an issue. All right, Mary, Community Grant Cycle 1, update and issues.
All right, I'm going to turn this over to Deputy Director Sean Smith, who's going to walk us through these slides.
Good, thank you. The first slide here is basically just a summary of the 2024 community grants. Approximately $78 million was awarded for 2024 through 2025. That's for a total of 114 grant awards. Approximately $235 million over the course of the 3 years. And that's for 1 to 3 year projects for 85 district organizations or grantees. Excuse me, next slide. All right, this slide has been updated. So the information in the binders will not match what's on the slides. So for total contracting and invoicing updates, as of today, we have contracted, fully executed a total of 106 contracts with the grantees.
Outstanding.
Very good. Next slide. This has also been updated, so what's in the binder is not going to match what you see on the slides here. So as of December 12th, we've processed a total of 171 invoices with a total amount of $5.1 million. Really, really good. I will also say too, is that, we've just recently created a process to where we are able to identify invoices that deny in real time. Before it was really based on, grantees reaching out to us and letting us know, hey, our invoices have denied. So we've got a more real-time process for identifying those. When we identify those denied invoices, we're able to problem solve to address it, whether it's an internal system with our invoices, or if it's something that the grantee didn't do or may need to do to be able to resolve the problem. And this is all in the effort of getting those invoices paid as quickly as possible. Okay, next slide, please. We've got two issues here that we're wanting to bring to the council for a motion. The first one is with UT Memphis. UT Memphis, their grant proposal was actually approved by the council at the March 18th meeting. The grant is for a one-year contract for $3 million, and that was to establish an endowment that would go to fund a faculty program that would be providing opioid education to various community stakeholders. After some discussions with the AG's office, we learned that we cannot legally contract for an endowment. And so we shared that information with UT Memphis, and they came back with a proposed alternative proposal that would be a 10-year contract, still for $3 million, $300,000 each year for 10 years. So we're asking the council to make a motion whether to approve this 10-year contract. I will also add that we've asked UT Memphis to provide us with the 10-year budget plan, and we're still waiting on that information. But we did want to go ahead and present this to the council to make a decision on whether or not it's permissible to have a 10-year contract term.
So it's the same amount of money, we're just spreading it out over 2 years.
Just to clarify and confirm, they're able to accomplish what they proposed with the change in payment structure?
That's my understanding.
With what they presented to us, yes. And one of the things when we get in here, I've looked at this, it's innovative. And sometimes when we get innovative things, we don't know what to do with them, and we stifle them off because we got a bunch of rules, bogging us down. This is an example of innovation. So, if we could do this, I would encourage us to do so. It's the same amount of money. It's just over a 10-year period rather than the 1-year period we were looking at, and they still get that accomplished, Brian.
Could you tell us again what exactly they would accomplish in those 10 years?
You want to review? Sure. So the plan is that over the course of the 10 years that they would be providing opioid education to various stakeholders, families, parents, opioid providers. And this would be provided by faculty at UT Memphis. Initially, again, this is something that would be funded. They were planning to do this as a part of an endowment. So the initial plan was to take the $3 million and deposit that into an endowment and just use the interest from that to fund this program. And so when we told them that that wasn't, that we would not be able to contract based on the endowment, this was the alternative.
It's still going to let them accomplish what they set out to. The community education is part of stigma reduction, and then the workforce development is really the thing that that I love about it.
It's not just one faculty member; it's we go to multiple faculty members.
Actually, I believe it's only just 2 faculty members. Yes.
It's the same amount. It's the same amount of money, and it's already been awarded. We're just giving them the opportunity to use those funds within a 10-year period instead of trying to rush to do it all within the fiscal year.
Well, they were actually going to invest it and then in an endowment and then use the interest to do it, which I frankly love. Okay, but we can't allow it, right? So this is the workaround for that. Still with the same goals out there of stigma reduction and then workforce development.
Karen Pershing has her hand
I'm sorry, Karen. You're so
Yes,
tiny on this, Karen.
yeah. I just have a question, I guess, for Sam. If we have established already when people apply, they have to apply for either 12, 24, or 36-month contract periods, are we able to do something beyond that?
Yeah, and I think we talked about that, JP and myself, and believe the council does have that discretion and authority. One of the things to consider is, and that was on the previous slide, is one, making sure the comptroller is good with that as well, because there is state law which basically says if there's any contracts beyond 60 months, they do require comptroller review and approval. So I just want to make sure that we point that out. And the current structure of the contracts that we had in the template did contemplate at least 60 months. But yeah, that ultimately, to your question, Karen, I do think the council has that authority and discretion.
Okay,
So the
thank you,
lawyers
Sam.
can correct- Thanks, Karen. The lawyers can correct me if I'm wrong here. So if we approve this motion, it would be pending the okay from the comptroller's office. Yes.
Yes, that's correct.
Okay, no, I'm good. Want to make sure I understood. Okay, does anybody else have any other questions? I'll entertain a motion.
I'll make a motion.
And a motion to approve by Sheriff Fontes. Do I have a second? All right, second from Mr. Wyckoff. Wayne makes me smile. All right, any discussion? All right, hearing none, Mary, would you proceed with the roll call vote?
Armando Fontes,
Yes.
Ron Buck,
Yes.
Casey Cox,
Yes.
Clay Jackson,
No.
Karen Pershing,
No.
Lisa Tipton,
No.
Mike Flynn,
No.
Shane Sexton,
No.
Stephanie Vanderpool,
Abstain.
Steve Lloyd,
Yes.
Tim Fournette,
No.
Tommy Farmer,
Mhm.
Wayne Wyckoff.
Yes.
Right, so 1, 2, 3, 4, 5. 1, 2, 3, 4, 5 against, and 1 abstain.
If it's 5-5, it fails.
Oh, okay.
There is a hanging chad. You are correct.
It's against 4.
Okay.
The votes were 5 yeas, 6 nays, so the motion fails. And I am not sure what the way forward is with that, so I assume that we will.
We'll have to take this back to UT Memphis, and they'll need to make a business decision about how to move forward.
Understand? All right, thank you.
Can I ask
All
a
right.
question?
Absolutely, Mr. Wyckoff.
Is there any reason why we can't basically accomplish the endowment in-house? In other words, we keep the money, we get the interest on it, and we pay them on a yearly basis.
I'm going to defer to JP and Sam on that. I can't balance much out of it.
That's essentially what would end up happening in that situation. Instead of UT's endowment investing, and just to give a little more clarity to that, that state funds can't be invested in equities, so the stock market, et cetera. Whereas their endowments are that they're separate funds, they're not state funds to begin with. The funds here are owed to the state, held by the state, so they're state funds. And so they're invested in debt. I won't go too deep into this zone, but in different things other than the stock market. And so under the structure with the 10-year agreement, the state holds, or the Treasury is investing the opioid money in the allowable investments. And so there is interest being spun off on that. And so the Opioid Abatement Council and the trust fund gets to hold that for the 10 years under the previous proposal versus UT holding it for the 10 years and using the interest. So to your question, that's what was going to happen essentially, just at a lower interest rate likely.
Thank you, JP.
Sure. I do have a question. Would it be wise to go ahead and get the comptroller's input as well as far as for next meeting? That way we would know what is allowable based on 60 months or longer. Because they're going to they come back with a proposal that's for 72 months and we're going to be in the same boat. Because I kind of we're looking at an amount that's already awarded for an educational program that you're going to make them just flood the system for a year. Whereas if they can stretch that out, then you're now putting an educational program all in that area for a few fiscal years. And it's all approved already.
So JP, is that, can we go ahead and see what, I mean, on the medical board, we call that an advisory opinion. So can we do that?
I can't speak for the comptroller, but certainly worth asking. And I would venture that the comptroller would give us an answer.
Okay. So can we just let you and Sam work that out and get back to us? Is that okay?
I'm happy to help with that.
Okay. All right. Thanks, Sheriff. All right. And there's a second part to this one, I think as well, Sean. Not to the same proposal, but we got another.
He's got one update and then another decision.
So this is just a quick update on fiscal monitoring. Of the 114 grantees, we have reviewed all 114 grantees' financial statements. This was the financial statements that were submitted as a part of their grant applications. Let's see. Okay, I'm sorry. I'm looking at that.
Yeah, that one is delayed.
Okay, that's okay.
There you are.
So the slides actually, this is all in the effort of trying to give you all the most up-to-date information. The information on the slides is actually outdated now. So the slide says there's 17 risk assessments that's been completed. Actually, we've completed a total of 27 risk assessments, with 25 of those risk assessments being moderate risk and 2 being low risk. The reason why these risk assessments are important to us is because they kind of help us to identify which grantees are going to be high risk or where there's an urgency to complete the fiscal on-site monitoring. The goal is to complete 100% of the grantees' risk assessments by the end of the year. As far as site visits, we've already completed 2 site visits for grantees. That was on December 4th and 5th. I'm happy to report that, there were no significant findings with those 2 site visits. We have 15 visits that we're scheduling or working to schedule to occur between January and March of 2025. Of those, we are the grantees with a 1-year contract are priority, and we're wanting to go ahead and make sure that we get those completed first. Next slide, please. Rollover community grant fund. So we're seeking the OAC to consider a motion to approve rollover funds for community grantees cycle 1. So just to give you a little bit of history, as I had reported before, we are very close to wrapping up all 114 grantees contracts, executing those contracts, but there have been delays in terms of getting those contracts executed. As such, we've had several grantees reach out to us to ask if we could possibly carry over some of their year 1 funds as a result of their delay in getting their contracts executed. So we reached out to the department's chief budget officer, Gene Wood, to get an idea about how carrying over funds how it looks for department grants. And so what we were told is that for the OAC grant funds, that these funds don't automatically roll over, they're reserved. So what's not spent basically just goes back into the pot. So we're asking for the council to make a motion to actually have a process for rolling over those grant funds for cycle 1. I will add to this as well is that I do think that this is probably something that's going to be less likely to occur in cycle 2, with the year 2 and year 3 funds, because just because of the lessons learned, I think we're going to have less delays in getting those contracts executed.
Thanks, Sean. We talked about this at the very start when we were trying to decide, how fast we wanted to go with this. And you all know this, it's trite, but it's true. We're building this thing as we're driving it down the road. And it certainly sounds like the delays here were on the contracting side because we were trying to get up to speed with that. For those of you in the audience and online, I don't know how many times I've gotten this question. Hey, why does it take so long getting the money out? We allocate the money, but then we have to execute the contracts. It's the first time we did it. We basically had a bolus, sort of like a python swallowing a zebra. And so it takes a while to digest that thing. And so we're currently digesting it. And so I guess what Sean's asking for right now is, because this sounds like it is on our end, is to permit a rollover in year one. And as we get further down the line, then this becomes less likely because we should have digested a lot of this.
Mr. Chairman, I make that motion.
All right, thanks, Judge Sexton. So I have a motion to accept by Judge Sexton. Do I have a second?
Second.
Second by Sheriff Cox. Any discussion? I'm sorry.
May I make a friendly amendment? I wanted to be specific, not spent from 2024 as opposed to from the previous year, because I don't want this to be an indefinite rollover. I'd like it to be very specific that we had challenges getting the contracting out in 2024, but now all the contracts have been executed. So if people are not spending their money in 25, that money should not roll over. And I'm concerned that the way it is worded may allow kind of indefinite rollover, which might lead to underutilization of funds. So my recommendation would be to amend this motion to state grant funds not spent from 2024.
Thanks, Dr. Vanderpool. Actually, I understand that. Judge Sexton, is that?
Certainly,
is that acceptable?
I agree with it.
All right.
Yes, I agree with this.
All right.
Year one or 2024. This as long as, yes, I agree. This does not need to be a perpetual thing. So.
And Sheriff? Yes. All right, so friendly amendment seconded by the original motion and second. Is there any further discussion?
Is there any length of period this money rolls over to? Does it have to be spent in 2025 then? Is that stated?
I think that was the point of Dr. Vanderpool's amendment, was that, yes, it would need to be spent now. If you got money left over at 25, we're not addressing that. We're addressing the rollover for the year that it's basically on us for delaying the contracting. Somebody can correct me if that's wrong, but I think it's right.
I agree. And I want to state that it doesn't prevent us from revisiting this at the end of 25 if we need to make another motion. I just don't want something we set in motion today in December of 24 to continue on through 2027, if that's not what we need.
Mr. Chair,
I appreciate it.
It's certainly meant for the first year, not to go on in perpetuity. So yeah, the language as typed out looks sufficient. I mean, as long as we're staying within 2024, this money was what was let out that particular calendar year. So.
And we reserve the right to revisit it anytime we see fit. So I'm good with that. Thanks, Stephanie and Judge. All right, you want to proceed with the roll call vote, Mary?
Armando Fontes,
Yes.
Brian Buck,
Yes.
Casey Cox,
Yes.
Clay Jackson,
Yes.
Karen Hershey,
Yes.
Lisa Tipton,
Yes.
Mike Flynn,
Yes.
Shane
Yes.
Yes.
Stephanie Vanderpool,
Yes.
Steve Lloyd.
Yes.
Tim Fournette.
Yes.
Tommy Farmer has left. Wayne Wykoff.
Yes.
All right, the motion carries. Thank you all. All right, Community Grant Cycle 2 updates.
Yeah.
Mary, today's a big day.
What's happening today,
Yes,
Steve?
yes.
I don't know. I'm sure my email will tell me when I get back home. All right, just as a reminder, schedule of events, and this is posted on the Opioid Abatement website. Yes, today is the last day to submit an application for Community Grant Cycle 2. The portal will close tonight. And I have this on 3 inboxes out of office, but hey guys, I'm sitting right here. So if you've emailed me, as soon as I get done with this meeting, I'm going to respond to your questions, okay? Hang tight. And Melissa just sent me a new updated number. 163 submitted proposals so far. And lots of draft applications, lots of portal logins, and thanks for all the views of the video. I may be going viral. So thank you for watching the training. I hope it has been helpful. All right, so stay tuned for this, council. I'm very excited. I think we've got a lot of grassroots, local applicants. So we will be getting those. We will be in touch on the scoring after the new year.
So that number continues to go up as 107, it's jumped to 169.
Yeah, 107 was this morning, and was it 163, Melissa? Yes. 163. So folks are submitting them. So thank you guys so much.
Thanks, Mary. Any questions around this? I don't know about you guys. I didn't know what this number would be. It looks like it's going to probably approach, sort of like me in high school, it's going to approach 200 before the night's over. So I was thinking that, me personally, I was thinking we would probably get 100, around 100, 110. So it's a little more than I was expecting. So I'm excited about that. Anything else?
Yep.
All right. County funding update, next steps.
Okay, so we have talked a little bit about this in the last meeting, and we've got a couple of updates. But just again, putting in front of you the amounts that we have dispersed. In 2023, it was 31.4 million, and in 2024, it was 31 million. And then updating the allocation and spending, this number has gone up since our last meeting. Ella, I think it was 7 million the last time we met. And so we have received a few more reports from counties, and they have spent a little bit more. So making some progress here. Also want to bring in front of the council a request for the counties that were affected by Hurricane Helene. These are the counties that received the disaster declaration, and just asking the council if they would consider a motion to allow for a 6-month extension for their semi-annual report that was due in September 2025, and also give them a 1-year extension for allocating and spending funds for those counties impacted by Hurricane Helene.
I know I'm not supposed to politic from this there, but guys, I'd like to do this.
Mr. Johnson City native, I'll make that motion.
All right, thanks, Mr. Wyckoff. We have a motion. Do I have a second? Second. The second by Sheriff. Any discussion? We'll proceed with the roll call vote, Mary.
Armando Fontes,
Yes.
Ron Bud,
Yes.
Casey Cox,
Yes.
Clay Jackson,
Yes.
Karen Pershing,
Yes.
Lisa Tipton,
Yes.
Mike Flynn,
Yes.
Shane Sexton,
Yes.
Stephanie Vanderpool,
Yes.
Steve Lloyd,
Yes.
Tim Fournette,
Yes.
Tommy Farmer has left, and Layton Wyckoff.
Yes.
All right, motion carries. Thank you all. All right, SAS and data visualization.
I've got 2 more
Oh,
slides.
sorry.
Yeah, sorry, just to walk through more.
Thank you.
Man, where are they going?
I know.
Okay, so this slide is back from our last meeting, and the council voted for the office to create a reversion, extension, and education process. So Ella, who is just all over the counties right now, working with them, contacting them, making sure they're about to get their letters of agreement. She has been working on this process. So Ella, can you give us a brief update on this?
Yeah, so thank you, Mary. So as a reminder, the counties each year before they receive the funds from the Opioid Abatement Council, they must sign and return a letter of agreement. And within that letter of agreement, it states that they have 2 years to allocate and 4 years to spend. So this is the current funding process that we have in place right now. We are approaching the 2023 timeline of allocation. And so in our March 2025 semi-annual report, they will report their allocation and spending, but also they will go in a deeper dive of the progress that has been spent from 2023 county funding. And in that report, we will also offer an option for counties to request a 2-year extension. And within that extension to allocate and spend, the counties must provide a plan and reason for that extension. They will also continue to report on the semi-annual report two times a year, and will have an option to receive education and consulting with SMART initiative or work with a third party. If we do get to the point of where reversion of funds do happen, we are going to be requesting county mayors to meet with the executive director, Mary, and deputy director, Sean, before any reversion of fund process begins. And then if that happens, we will send a notification out, and they will have 45 days to submit a refund check to the Opioid Abatement Council.
Any questions on how we're designing this process? Okay, Ella, next slide.
So we briefly spoke about this earlier, but this is the update on SMART initiative contracting. We are in the contracting stage of SMART sending us the scope of work, reporting information, and budget for the contract. We are reviewing that contract and drafting what's going to look like, and the ideal timeline hopefully in February if it moves forward. But currently, SMART Initiative is helping out with a few counties that have not submitted the September semi-annual report.
And just want to shout out to their executive director, Jennifer Torville. We've already met with her, and we're looking forward to a very collaborative working relationship and partnering with them to help the counties. So thank you, Jennifer, and your team.
Absolutely. Thanks, JT. All right, any further questions around anything that Mary has put in front of us? Feel good about this process going forward. I've been worried about the county for a good while, except for in counties where, really feel like they've got a good advisory bunch around them. But that's not the majority of our counties, particularly our rural counties. So I love having a path forward with this. It's complicated issues. I don't mean to disparage our surgeon colleagues, but we're not cutting out a gallbladder here. This is building a system of care, and it can be complicated. So I'm grateful for the work that's been done around here to help our counties. All right. Now, am I good to go, Mary? I got Nancy last time.
Yes.
All right. SAS and data visualization. Joseph.
All right, Joseph, we didn't do, I see you there. All right, fantastic. Hey, guys, the council, we have been meeting weekly with the SAS team, and Joseph is one of the lead architects on developing the visualizations. We have already posted some of the county visualizations on the website, and we're working on the community ones, and I wanted y'all to hear from SAS. We're spending a lot of money on this project, but I think it is well worth it so that we can see visually, obviously, the work that we're doing. So Joseph, mic check, make sure I can hear you.
I hope so. Am I coming through?
Yes. That's great. Okay, Joseph. And I've got your first, there's a little bit of delay.
Yeah, we can jump ahead. That's fine. Yeah, let's jump into the agenda slide from there. There we are. Okay, now I'm seeing it. So just briefly, we're going to cover the, when we met last June, we had shown the annual county grant dashboard. That was showing the reported funds directly dispersed to the counties, as well as the allocation and spent percentages. We have that with some of the updated data now. In addition to those previously presented dashboards, we're ready to show some of the dashboards for the community grant reporting and how we're trying to enable some of the transparency on the spend through on the community grants. And then we'll get into what's next after that. Next slide. And just briefly, why are we here? We're here as a business partner to the Tennessee Council, providing our analytics and modeling expertise. We have our project team listed down below. A group of experienced analysts and data professionals, as well as subject matter experts in public health and health policy, trying to help both on the transparency side with the development of these county disbursement and grant specific funding dashboards, as well as the development of a predictive model for the fatal and non-fatal overdose to try and help assist for insights to the council while they're making their decisions. So first here you see the county reporting dashboards. This is part of what we had seen previously in June. Again, just to reiterate, we have the high level kind of along the middle, just below the Tennessee branding on the total amount spent and funds dispersed. Given some of the previous slides, it looks like we need to get the most recent of the amounts spent, though we do have the dispersed amounts there. On the upper right, rather, you can see the distribution of that percent spent across the counties, as well as a tabular format, the lower right, and then kind of a top 10 on the lower left. And kind of give it an overview of everything. On the second tab, this is the ability to dive into specific counties of interest. So those bar charts there will adapt to the county selections up there. You can go in there and click the counties of interest and they'll appear. Otherwise, it just comes down to them alphabetically. Again, we also have the maps. They can be selectable on the maps where you see a hotspot, and then the tabular data there on the lower right. And then finally, there is on the next slide, we have the raw tabular data. This is sortable, filterable, select specific counties again. In the upper left, each of these is adaptable for any of the given reporting years, so 2023, 2024, and forward, as well as overall across all years. And those additional tabs there, the printable reports, those are the ones that are actually published out to the web page and exported directly from here. And this next one, this is this is the community grants dashboard. This is to enable the transparency in seeing how money is flowing through and flowing out, both to the individual agencies that are receiving the community grants, as well as overall by the project strategies attested in their grant applications. So in the center on the left, we have the total grant funding and the overall grant funding and total paid. I believe our last data update came in from the end of December, so we're looking forward to adding the additional data in there. We have a date selection range there if there's a specific date range to look at. On the bottom, we have the combined bar and line chart there is showing when specific amounts of money have gone out over time, as well as the running total in the red line overall showing as that spends through. In the middle, this is where the selection and filtering happens. So we can either look at individual project strategies or individual agencies. That's toggleable at the top. The combined bar charts there are showing total grant funding. And as the money gets spent through, you'll see that red line will go towards the total granted amount. Again, select by the checkboxes for individual project strategies. There's a filter there to enter in specific agency names that you want to see. On the right-hand side, this is when money is going out by date. So paid amounts, payment dates, which grant funding cycle it is, and the total grant funding for that agency. So this is where all the interesting stuff is to kind of see how the money is moving through. Finally, we have here the tabular format. This is the listing out of all of the applications, organization, project name, strategy. This is sortable by any of the columns here as you begin to investigate. The key indicators across the top in terms of the applications that have been delivered across to us, as well as the total amounts paid and approved funding. Filters by the strategy, by the state grant division, by the funding cycle, and by the individual organizational names. And then looking forward, finally, we're working with the council on the non-fatal overdose model. This is in some of the final revisions and ready to begin being previewed by the council. So we hope to be able to present this soon. And this is a model that is breaking separately fatal and non-fatal overdoses, so two different models, as well as dashboards to support looking across the state at the different county levels, which factors appear to be functionally related to overdoses in those different areas of the state. Visualizations to support that, changes over time, changes geographically from different parts of the state. We're pulling from various public data sources provided by Tennessee Health, by the U.S. Census, specifically the American Community Survey, U.S. CDC, as well as some other public sources as required. The modeling dashboards here allow us to look at the insights coming specifically from the predictive model. We've also included baseline measures to look at factors that outside of the specific focus of the model are known to contribute to overdoses. The council has a full view of those as well. And we're looking forward to getting that into production so that it can be used.
Joseph, thanks so much. And thanks to you and Sarah and the whole SAS team for pulling this together. So council members, what we're going to have on our website will be static pictures. We may try to put something up there that the public can engage with. We're still looking into that, but this is again, our commitment to transparency to show the public where the money is going. And so I'm very, very excited about this. And this what's next. Hopefully sometime next year, we'll be able to get this information in front of the council before decisions are made for the community grant cycle too.
All right, before I go, does anybody have any questions? Because I've got some things I want to know. All right, hearing none. So just a couple of things. When we look at county level reporting, I love the fact that we're putting out how much money we give them and how much money they've allocated and how much money they've spent. Are we going to tell them what they spent it on?
For the county, what we're getting from the county reports is only by strategy and how many people. So I don't if County A spends it on treatment, I don't know any more detail other than treatment. So all we know is what they put in the semi-annual report.
So what kind of latitude does this council have on asking for that? Because to me, we have our community grants here. We have who got the money, how much they got. We can pretty much look them up and see what they do. We don't have that with the county level money, and I would like that level of transparency. I would like to see where they're putting it. There's a lot of different forms of treatment. There's a lot of different forms of prevention and all of that stuff. So I would like to know, do we have the latitude to ask for that?
Can I say just one thing? The semi-annual report is based off the letter of agreement. So what we directed them to do in the letter of agreement was, spend it on one of the 6 strategies that's outlined in the remediation list. That's all I want to say. JP?
I wouldn't say that you have any teeth to any sort of mechanism to get this data and force transparency. But I will say you are the statewide opioid abatement council, and you have a lot of authority and a lot of sway in talking to the counties and demanding transparency because it's good for the mission of everyone here.
I think so as well. That memorandum of understanding that we send them, I wonder going forward, can we change that to ask for that? Dr. Jackson.
Mr. Chairman, I think you could change the letter of agreement moving forward. Also, if you can get one county to report it, and then you put that on the dashboard, then you can tell all the other counties, this county's being transparent, why are you not?
Right. And
if they have a constituent from the county, they're looking, and they can see in Hampton County what happened, but they can't see in Clay County, for instance,
right,
or Jackson County, which is just below. They could see if they weren't transparent, that'd be a problem. Right?
No, I appreciate
soft power. I would agree. We don't have any teeth.
I appreciate that, Dr. Jackson, and anytime I can use shame, I'm for it. But I think it's important. It's the thing I've loved that Mary and I presented last year at the RX Summit, and we got to take what JP taught us to everybody. With transparency, and it went great. And you see other states that don't have it actually working in another state that doesn't have it to the degree that we do. And it presents issues because you find out about it when it shows up on the front page of the newspaper. And it's we don't have to worry about that. So I would like to look at that going forward. And Sash, for you, I've got this question. One of the things I like about being in other states is you can obviously learn a lot. And in one of the states I'm working in, West Virginia, when we look at predictive modeling, West Virginia has 3 interstates that intersect in their state. It's basically drug highways, pretty much, and they know that when a shipment of adulterated fentanyl hits Baltimore, they know within an hour. They can predict within an hour of when it's going to show up in the major cities of Charleston, Huntington, Morgantown, Wheeling. I'm forgetting down in that corner state, forgetting the town down there, but they know. And so what they do is they deploy what they call rapid response teams to start flooding those areas with overdose reversal drugs and resources to hook people up with treatment before the drugs ever get to where they're going. Can y'all do that?
Well, part of it's a data limitation and the agreements. I know that we've worked with the state of New Jersey with their IDAD. Specifically working with a combination of public health as well as law enforcement on those rapid responses. I'm not sure we have access to that level of data in this specific project. What we have is not exactly that timely. Down to the minute, we have these public data sources which have significant time delays. The overdose reports themselves, they're current up through 2023. We're still waiting on final approval of the 2024 numbers in order to get the models updated.
So this is a discussion I'd like to have. This is probably not the place for it, but if there's something that's preventing us from getting that data, then we need to look at that so that we can get that data. Other states have been able to make progress here. The states that I'm talking about have seen massive drops in overdose deaths like the rest of the states, but they actually beat the United States average by significant amounts. And I think there's a reason for that. So I would like to talk about that. I mean, it's one thing to sit here and say we can't get the data, but I want to find out, is there a way we can get the data and make that work? Because we have I-40, we have I-81, that crisscross our state, 65, 75, running through our state. So we have the same situation as West Virginia. And I'm sure that with available data, we can pinpoint where our drug shipments come in from, be it Atlanta, Detroit, wherever. And my guess is that we could build that same predictive model, and we know when it's going to hit Nashville, the Tri-Cities, Chattanooga, Knoxville, Memphis. So I would like to talk about that because I just love that idea. And I can't watch a dadgum football game without the AWS coming in and telling me that, Christian McCaffrey does the leap over this guy and he had an 8% chance of scoring. Right, we've got data down to that level. Surely we can start to look at having access to some of this data that's going to predict where these deadly shipments are going, and we can be prepared for them before they get there, because I think we can save lives that way. So I know that's a discussion for another time, but I do think the juice is worth the squeeze. So thank you.
Can I ask a question?
Yes.
Are these relational databases you're using?
Joseph, did you hear the question from Mr. Wyckoff?
Yes. So we use the relational databases in other implementations. There is some of that on the back end. This specifically is coming in as regularized flat data sets. Just the size is not really that large for the level of specificity that we have to require a relational database.
Can we get the database design?
Yeah, we can provide that information.
So, Rick, can we get Mr. Wyckoff in touch with what we need to make that happen?
Yes.
Okay.
Yes.
Thanks.
Hey, Dr. Lloyd.
Yes, yes, I'm sorry.
This is John Brocklebank, and I just wanted to comment on your real-time opportunity. We certainly have the technology and the software to handle that if the data is available. It's called event stream processing. So we'd be happy to investigate that.
Yeah, I'm dangerous right now because I know so little and I have a wild imagination. But I would certainly like to look at that because, when I watch these rapid deployment teams go out and actually, they're ready when these things start happening. I mean, minutes is life saved, right? When somebody goes down, you got about 6 minutes before you start losing brain tissue. And, if you already are prepared, where these shipments are going. I mean, I've talked with police chiefs, and really the key here is the cooperation between public health and law enforcement. That's the key. And we have multiple, in West Virginia, there's multiple state police agencies that have peers embedded within their police force. So when they show up at the overdose, right, they get them before they die, which is highly important, right? But at the same time, they've got somebody right there with them to hook them up with treatment. And guys, that's cooking with gas right there. And I think
we're doing that. Yep.
Yeah.
Thank you.
Dr. Lloyd?
Yeah. Yes. Oh, I'm sorry, Commissioner.
That's fine. No, that's fine. Just a couple of comments. Even though we don't do this real time, we are doing it in collaboration with the Department of Health and federal government when they tell us that they're going in to make some sort of arrest or raid. I want everyone to know that is happening today. Yeah. Secondly, I want to tell you this is something that Commissioner Alvarado is looking at related how to move up the data sets so that they're not lagging so far behind. He and I actually talked about that at the cabinet retreat. So I know that's something he is reviewing. And then thirdly, as you know, Dr. Lloyd, from what you're doing in other states and what I do in other states, there's a bunch of different vendors who have different products to do what you're talking about. it might be good to have an exploratory group look at that and bring it back to the council for further review. So that's all I would say.
I appreciate it, Commissioner, and I'm talking to the council about this in just a second. So I'm so glad you're on here because, you know, to me, our council is complementary to what's going on from the state agencies. And I, you know, back even when I was working with you, Maria, I remember, you know, what David Reagan and some of the folks at you know, Department of Health were doing. And so for this council to be able to look and see how we can supplement with the dollars that we have to be able to move some of these systems forward, I think it's a good opportunity. So if it's okay with you, I'm going to give you a yell and see if you and I can get together at some point. Would you be opposed to that?
Not opposed at all. And what I'd appreciate is when we get together, if you know of a state that is doing what you think is the best way to do it, give that to me and I can speak to Commissioner Alvarado to just get a sense of his thoughts because he also has connections with other states.
You bet. You bet. Thanks, Commissioner. And I'll be doing that. I'm grateful. All right. That's
the last of the content.
All right. The last of the content. And so I appreciate everybody, you know, working through the technical difficulties and addressing our business at hand. I feel like we may be getting a little better at it. And I say that, and I guess everything will come fall apart now, but hopefully not. Yes, sir, Dr. Jackson.
To that end, did we vote on the MTSU hustle recovery contract?
I accidentally put that in there. We have tabled that. We've got to get more. Got it.
Sorry about that, Dr. Jackson. I should have addressed that.
Yeah,
That's why we didn't have it up there.
That's what I'm saying.
So there was in our materials, there was a MTSU hustle recovery portion in there that we were going to address, but I wasn't aware of it. It needed to be pulled out, and we'll talk about that after the meeting if that's okay. We reached our time for public comment. In keeping in compliance with the Open Meetings Act, we have a period for public comment. We ask those that are going to give public comment to limit your remarks to around 2 minutes. I don't have a stopwatch, but I have an antsy feeling in the middle of my belly. Just keep in mind that it's not a Q&A session. There will be times that we get public comment and afterwards we will direct people where they need to go. We always try to do that actually, but it's not a Q&A session. So I'm not sure which microphone we're going to use. Right there beside. You get to sit between Elizabeth and Mr. Wyckoff. I would trust Elizabeth. I would watch out for Mr. Wyckoff. So does anyone have public comment?
Thank you. Hi, I am Mackenzie Carter, and I'm a prosecutor in the 17th Judicial District. And first, I just want to thank you all for your diligence and your dedication and your work that has gone into, I think, the years of getting to here today and what y'all have before you. What I'm here to discuss today, and I'm here on behalf of the Marshall County Recovery Foundation. I specifically am a crisis prevention prosecutor. So most people, when they hear prosecutor, they run the other way and they think that there is no treatment. We want to stick you in jail and throw away. Our Marshall County Recovery Foundation realizes that this is not the answer. And I have a great district attorney that I work for, and he realizes this is not the answer. And so what our program, it's the Rural Crisis Response Team, is what I'm a part of. And what we seek to do is divert people that have substance use and or mental health disorders. And let's be honest, if you have a substance use disorder, you gotta have a mental health disorder. So divert those people out of jail into treatment. And the individuals that I'm talking about are low-level nonviolent offenders. The last thing you want to do is put a coyote in the chicken coop because all you're going to have is a bunch of dead chickens and a few extra coyotes. So there are, I think, programs out there that deal with much higher level offenders, but that's not essentially what our program does. If you're familiar with the sequential intercept model, we deal with 1 and 2. This is an innovative program. It's an amazing program, but we have an issue. Come June 30th, all of the individuals that we're working with in our program, we're currently at almost 30 offenders that we're working with. And this is in 6 weeks. These individuals will have no oversight, and this community resource will be gone. And that is because the Marshall County Recovery Foundation applied for a 1-year grant in cycle 1 funding. Had they known that they would not be able to apply for cycle 2 funding, they would have applied for a 3-year grant. They did not. So come July 1, everyone that is in our program will not have oversight of the district attorney's office, and they will not have oversight from our rural crisis response team that's currently overseeing this program. Further, the resources that are provided at this intercept level 1, those will be gone as well. So those are individuals we are intercepting before they are arrested. I serve as a link between law enforcement, treatment providers, the court system, and offenders. This resource will be gone. So what I'm here today asking you all is to consider allowing cycle 1 grant recipients to amend their contract to be extended for 2 more years, and also increase that grant liability for those other 2 years. And I believe I heard in the presentation just a few minutes ago that there were 107 contracts awarded, but there were 107 grant contracts that went to contracts, but 114 that were awarded. So for the reserved funds, which are, from my understanding, cycle 1 funds that are unused, what I'm asking is that you allow at least our program, if not others that find themselves in the same situation, you allow us to extend the term by 2 years for a total of 3, and then use unused grant funds for the cycle 1 to fund our other 2 years. I appreciate you all so much. I appreciate your time, your attention, and this concludes my business unless you all have questions.
Actually, I do. So I guess we have that latitude, although we didn't give it to you. I understand the oversight issue come July 1, but what about new initiatives come July 1? Stop.
Correct.
How many people are we talking about right now?
As of today,
Yes.
in our 6 weeks, we're talking about 27. And that's in 6 weeks.
And this is a smaller community that you come from, correct?
Yes, sir. This is Marshall County.
That's significant.
I don't know what's appropriate and inappropriate anymore. I love the work that's been done in Marshall County.
And I'll just piggyback off something you said earlier when you're talking about drugs and coming down corridors. Marshall County, do you know why they have one of the highest addiction rates? It's because the vice lords, their main hub between Chicago and Florida is in Marshall County. So what we're seeking to do is treat people that can be treated, heal them, identify them, get them out of the criminal justice system, and then take the resources that we would be using to prosecute these individuals and instead use them to prosecute the individuals that are bringing the drugs in.
It's a pretty amazing mindset, because you hear this from Marshall County, and you're not the only one down there. Giles County, I mean, some of our rural counties in this area are very forward thinking in this, and obviously I can't comment on it, but I've got some ideas. But I love the work that you do. I think you knew that before you came here today anyway. But to me, when I look around the country, these are the kind of things that start to bend the curve, because when you get somebody into recovery, they pay for themselves. And that's what our courts are allowing these folks to do. And the other thing I love is the passion. So thank you for that as well.
Thank you.
Thank
Mr. Chairman. Mr. Chairman.
I'm sorry.
It's Shane Sexton.
I'm sorry, Judge. Go ahead.
Let me ask, and maybe ask the Miss Carter. Was there a particular reason why you didn't ask for a multi-year, or was it just not knowing how this process would occur? Did you hear my
Your
question?
Honor, yes, Your Honor, I did. I am not a part of the Marshall County Recovery Foundation, so I was not a part of the actual granting process. But from my understanding, it is because they simply wanted to ask for the funds to start the initiative. But this was also their very first grant contract that they have ever participated in. So they didn't understand necessarily how it all worked. Had they known that it was limited to a year, then they would have asked for 3.
Thank you. Mr. Chairman, is this something that we can table and discuss over time? I mean, how we can, because this is going to recur probably at some point.
It is, Judge, because we're in the public comment section of this, so we can't address it other than hearing it, but I've got some ideas and we'll talk with, Mary and our council after this is over. We'll decide how to go forward. We need to address this. We need to figure out how. And if we do have an avenue to do it, but yes, we'll talk about it after the meeting.
Thank you.
Thanks, Judge. Thank you.
Thank you, Your Honor.
I saw somebody else stand up there. Mr. Taylor, are you going to? All right, Abby?
Ladies first.
Ladies first.
This is Brittany. I'll be.
All right, no, you can't do it from back there. You have to come up and sit next to Mr. Wyckoff. We want to see how serious you are.
Yeah, this is punishment. I'm Brittany. I'm from Knoxville. I'm here just to kind of speak on Next Step Initiative and how they kind of helped me, or how they actually have helped me and saved my life. So I've known Miss Addie for 4 years now. She came into my life when I was really at my lowest. She's tried to get me into treatment, and I would always blow her off. November 13th, I was released from Knox County Jail. I was out of jail an hour and I overdosed. I showed up on Miss Addie's door the next day, and she was able to work with the Next Door Recovery here in Nashville, and she drove me here herself. If it wouldn't have been for her, I just found out today that 2 days ago I lost 2 of my really good friends due to overdose, and that could have been me. That very well could have been me if it wouldn't have been for her, getting me here. I'm now, making my next step into Hermitage. I'm going to Lost Terms, and I'm relocating to Nashville permanently. Oh my God.
Thanks, Brittany.
Thank you.
Congratulations. Nashville is a great recovery city. I promise you that. Thank you. Just for the council's education a little bit, when somebody's released from incarceration, no matter how long they've been in there, their risk of overdose and death in the first 2 weeks after is 40 times an age match person in the population. And so, if you want to bend the curve on overdoses, we've got to get those folks that are transitioning out of facilities, and it has to be intentional. Thank you. Thanks, Ms. Adden. Will, are you going to speak, or do we have to live? Okay.
Miss Addie's not through.
Oh, I'm sorry. No, I'm sorry. Miss Addie, how about it?
Hi. My name is Miss Addie. My name's Addie. I work I'm the founder of Next Step Initiative in Knoxville, Tennessee. For the most part, we're a harm reduction center that goes out in the streets. That's not what I want to talk about. We had a halfway transitional house, I'll call it. For a while, when we had 13 girls come through there, 7 of them did great. We no longer have the money for that transitional house. What I want to, I hope I don't hurt anybody's feelings. Most of the transitional houses, all of them that I know of, you have to pay to stay. Ours, we don't charge you to stay. We do a savings program. We were talking about if we couldn't afford to do that because we didn't get enough money for it, we would do maybe a deposit to help get shampoo and all that stuff, but not to charge them all the time. What happens a lot of times from my scope, because I work on the streets, we bring the girls in, girls, we bring them in. Sometimes they'll do treatment. They'll come out. I'm going to be really blunt. If you live in the woods and shoot up for 8 years, you're not ready to go from 30 to 90-day treatment into a place where you have to work right away, you have to pay right away, and you're expected to, you still have to learn how to cook again, how to live in a house, use a toilet. I mean, it's really, you have to learn your basic needs first. So what we're wanting to do is open another Noon's house, but now compared to before, our executive director is I'm going to get the letters on LSCW. Did I get them right this time? So we now have open therapy. This transitional house would allow the girls to save them money to get out into their place. We did this, $6,200 and a KCDC voucher. So what the last girl left with, $3,200. She said we get a car, furniture, and we don't have a cap. Your cap is when you find a place. Hopefully we could do that quick so we can keep moving. But yeah, that's the cap. Okay, I'm a girl. I'm gonna just mention a couple of things that Sarah said I should mention because I roll on, so I wrote it down. But this would include an IOP, intense outpatient treatment, MAT program, a therapist on board. Of course, physical and mental appointments. We drive them to appointments. I guess what I want to say is there's no overnight fix for this, but this has a proven to work answer. And like I said, we work from people on the streets. There's no way they could go from here to here without that help. So we're wanting to make it a savings program / learning center so that we could really, and what we do, you guys gave me a grant, you might know what I do. This would be a continuum. And that's what it is. We make this relationship with people for 7 years, some of them, and we keep it. They trust us so that they'll continue with us if we could get them to that point where we could bring them into the center. Now we do, we make sure they have to do 30 days or more treatment first, inpatient. Then they come to us and are required to do an IOP. And mostly we want to work on their mental state and get them ready to work, like really ready, not just a lot of this we see, we bring them in, we get them. Once we get them past the treatment, our only option is not a good option. It's to put them in that where we said, and a lot of them go back out to the streets, which is causing more overdoses because, well, because they go back out to the streets. They can't afford to pay. They're not ready to work mentally. So it's, I guess that's all I really have to say about it. Just that's what we really want to do. And we have proof that it works because we've done it before.
Thanks, Ms. Addy. If you'll hang around after the meeting, I'll give you a little direction.
I'd love to.
Will, are you gonna come up?
That's not right.
Well, you look like you're getting ready to burst forward. So yes, come on up. Again. You'll just tell us who you are.
Yeah, so my name is Will Taylor, individual in long-term recovery. What that means to me is I've been absent from alcohol or drugs since 10/31/13. Ultimately, I'm the opposite of Dr. Lloyd's story. I was referred through the judicial system, right? I call that judicial love. Ultimately, today, at that time, it wasn't viewed that way. But learned to grow in a great appreciation. I've worked on several state initiatives, covered pretty much the whole state in the last decade. I currently serve as a harm reductionist. The reason I'm speaking is really just to maybe drop ideas, right? I know the advisory council's not yet, and that's not my gist on being here, but really just to, we talked about revisiting the MOU. I love the transparency that needs to be there through county levels. Ultimately, I hear that across the state. Something I want to drop with that was when we're revisiting that. There's a program called OD Maps, been very successful. I currently am a harm reductionist, and we have implemented it in Middle Tennessee's Grand Division in what we refer to as our high impact areas. Because of having instant data, right, we have been able to saturate areas with naloxone, treatment referral access, and things of such. Ultimately, our legislator, we tried to work through legislation to get that statewide. It failed. But again, the Opioid Abatement Council is in a unique position. That might be something we could add on to that MOU. And if the council's really wanting to help county level with data, which was one of SMART Initiative's talking points from the October meeting, what better place to get real true time data? The State Opioid Council funding OD maps for the counties, getting real time data, but then also sharing. See, it doesn't just stop with data. Ultimately, if you really want to do some homework over the weekend and over the holidays, I encourage you to look at what we're doing in Rutherford County. We actually started a fatality review board. Basically, what that is a collaboration of stakeholders now. We also, through that fatality review board, review case studies of individuals that did succumb to an overdose. Through those case studies, we ask ourselves amongst stakeholders while we're reviewing these cases, where could we do better? Where could we do things different? Where could we intersect and provide intervention? See, ultimately, as a collaboration of multiple other projects and initiatives going on, there has been a significant change of overdoses in Rutherford County alone, which was classified again as a high impact area. Other stories to support this, look at Metro Davidson County, working with police departments. Simply because ultimately I love our friends at Department of Health, but yes, that data is slowed. I understand the commissioner is working with the Commissioner Alvarado to get that time sped up. As a harm reduction, I received data that's 2 weeks old. Ultimately, that is too late. But working with law enforcement there and the use of their OD maps, we're getting 24-hour zip code pictures, prevention treatments. I want to put out there. I think that it's a great access, but if you ask me, I have a lot of great ideas. Thank you all for your work. Happy holidays.
Thanks, Will. I wish you guys got to hang out with me sometimes because there's a lot of great stuff happening in our communities. And there's nothing like being there and watching it happen. I've always believed I've never got an answer from DC and very few from Nashville. But I've got a lot of answers from the community. Yes, ma'am. Get right up.
I was gonna wait till you were done.
No. It's all good. I'm just running my mouth. Have at it.
I just wanted to introduce myself and my coworker, Savannah Ford over there. My name is Chelsea Moran. We work for Focus Ministries in Knoxville. We're very blessed to be here today. And so I just wanted to introduce our program a little bit. We have a huge presence in the county jails and in Bledsoe Prison as well. We are in Knox County, Anderson County, and Sullivan County jails. We also have a reentry home where right now we're housing 9 ladies, about to be 11, can house up to 12. So we are honored to be able to apply for this grant this year. It got turned in on Wednesday, and we're very, very hopeful. So I just wanted to introduce us. So thanks for letting us be here.
Thank you for coming.
Mm-hmm.
Anyone else? Yes, sir.
This will take about 3 minutes. I'm going to break your rule just a little bit. I'm Dr. Jared Matthews. I'm a board certified addiction medicine physician that practices in Memphis, Tennessee. I'm also the associate program director of the Addiction Medicine Fellowship at Baptist Memorial Hospital, which is the largest fellowship training program in the United States. Through that position, I'm involved in training the majority of the new addiction doctors in the state of Tennessee. I should say that my comments are not meant as a criticism of the work of the Abatement Council, but to rather concern the behavior of some other state agencies that directly impact the work of the OAC. I'm sure most of us here are familiar with the overdose death numbers, but I'm going to bring it up one more time. Overdose deaths declined in 2024, but it's not exactly time to celebrate. In a 12-month period ending in July of this year, more than 3,000 people in Tennessee died of opioid overdose. As recently as 2022, Tennessee was the second worst state in the United States in overdose deaths per capita. And only West Virginia had more deaths per 100,000 people. This is a disgrace and a humiliation, but you don't have to take my word for it. You can find this information yourself at the CDC's website under the heading Drug Overdose Mortality by State. It's our responsibility to ensure that the money awarded by the council has the greatest possible impact. My concern is that the policies of the state of Tennessee guarantee that it will not. Buprenorphine and methadone are proven as the most effective treatments to prevent overdose in patients with opioid use disorder. You can see this evidence for yourself online at the Journal of the American Medical Association under the title Comparative Effectiveness of Different Treatment Pathways for Opioid Use Disorder. This is one of the very few studies to undertake a real-world comparison of the various ways that a person addicted to opioids might receive help. We have identified the most effective way to save lives, and the state of Tennessee refuses to make this treatment more accessible to patients. Our state currently has in place some of the most punishing, restrictive, and intrusive laws in the United States regarding both buprenorphine and methadone. Tennessee imposes harmful limits on the doses of both medications, forces patients to undergo counseling that they may not need or want in order to receive treatment, and requires that certain minors undergo 2 potentially life-threatening attempts at short-term withdrawal management before they can be properly treated with medication. In December of 2023, our state's addiction doctors pointed out numerous ways in which Tennessee's laws restrict care and contradict medical evidence. In a letter written to the Department of Mental Health and Substance Abuse Services, the Tennessee Society of Addiction Medicine communicated 9 different Tennessee regulations that limit access to buprenorphine and methadone. We still have not received a response to any of the 9 critical recommendations for change 1 year later. If you have effective tools at your disposal and choose not to use them, you bear responsibility for the results that follow. Buprenorphine and methadone have proven to reduce opioid overdoses, yet Tennessee refuses to make them more accessible to everyone who needs them. I urge everyone here today to contact the Department of Mental Health and Substance Abuse Services and tell them that Tennessee deserves better. Thank you.
Thanks, Dr. Matthews. Okay, we got one person online. Is there anybody else here physically with us? All right, and I'm sorry, who is it online? Phyllis. Phyllis, I can't, I'm too far away, Phyllis. I can't see your last name, but hopefully we only have one Phyllis.
That's okay. I'm Phyllis. My last name is Zabwan. I'm a long-term recovery house owner here in the Nashville area. And I heard a lot of good things that you guys have been doing today, and I'm very excited about the future. What I think is extremely important and wanted to make sure that just to say is that sustainability of people that go into treatment and come out, I heard earlier, it's very difficult if they go back out to their old places. And when they come door to door to recovery housing, they have a little bit better chance of staying sober and sustaining their sobriety after their 30-day treatment. Because 30 days is not enough. You know, it takes 60 to 90 days for any of our clients to just begin to not be afraid to walk out on the street. So it is important that the sustainability so that we do not have as many overdoses, because I'm sure the statistics are much higher than what we think, because there's so many overdoses that I know that happen that don't get reported. So, you know, I think having the maintenance protocols and doing things and providing housing and assistance to people in recovery housing is going to be one of the key things in keeping the opioid disaster down. Thank you for letting me share.
All right. Thanks, Phyllis, and I'm sorry, when you got big on my screen, I recognized you. Hello.
That's okay, Dr. Lloyd, you're good.
All right, any other public comment online? I don't see any hands raised, and anyone here with us physically? See you there. So next up is our next council meeting, first quarter 2025 in East Tennessee. I have a suggestion. I'm going to catch Mary out off guard with this one, but we haven't been to Chattanooga. And I would certainly like to put that on our agenda if it's okay with folks. There's some really cool. Well, first of all, Paul Fuchcar is from there, so I mean it's a must see site just for that reason alone. Also, Chattanooga is a killer city, and it's in the spring. So if we get close enough, I can go on to Atlanta to a baseball game. Not that I would be looking that far ahead. But last but not least, they have a mayor there, Weston Wong, who has done some really innovative things in the greater Chattanooga area with regards to law enforcement, first responders, and I'm really excited at some of the innovation I see coming out of Hamilton County. So I would like to make that suggestion.
Okay.
So we don't have a vote or anything on that, but we've been to the Tri-Cities, we've been to Knoxville. And that pretty much leaves Chattanooga for at least for right now. So I'd like for us to do that if we can.
If anybody has a venue that you'd like to offer up, hit me up.
All right. Anybody have in 12-step parlance we call it a burning desire. Does anybody have a burning desire? All right. Hearing none, I need a motion to adjourn.
Motion to adjourn.
All right. Got a motion to adjourn. Do I have a second?
Second.
All right, Ms. Tipton's going to second since she's the one that helped us up when we got started. That's not true, Lisa. I'm sorry. Any discussion? Hearing none. Mary, would you proceed with a roll call vote?
Armando Fontes.
Yes.
Ron Buck. Casey Cox.
Yes.
Clay Jackson.
Merry Christmas.
Karen Hershey.
Yes.
Lisa Tipton,
Yes.
Mike Flynn,
Yes.
James Saxton,
Yes.
Stephanie Van Hempel, Steve Lloyd.
Yes.
Tim Burnett.
Yes.
Mike Wyckoff.
Yes. All right, motion carries. We stand adjourned.